Mets player had his glove up over
Against the screen?
no, it was over the top of the rail, and he caught the ball, and 2 Yankees fans ripped it out of the glove.
I saw that.
And one guy held his arm down, that was
Yeah.
nuts, so the other guy could pry it out, it was like,
What did they call that?
he caught it,
I
I
don't
called it
know.
out.
They called it.
It was obvious the guy
Foul.
caught it, so they had to fight to get it out of his glove. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I have mine.
I'm ready.
I'm set too.
Alright, pending issues, October 31st, 2024, volume 112, page 285, minutes of October 29th.
So move.
Second.
Roger?
Yes.
Tim?
Yes.
Fred?
Yes.
Page 286, bills.
Move to pay.
Second?
Fred?
Yes.
Tim?
Yes.
Roger?
Yes.
Page 287, additional appropriation.
So move.
Second.
Fred?
Yes.
Tim?
Yes.
Roger?
Yes.
Page 288, indigent attorney fees.
So move to pay.
Second?
Tim?
Yes.
Roger?
Yes.
Fred?
Yes.
We have 2 things to sign. The first one is, for all of you to sign. It's the 2024 County Highway System mileage certification. It's not due until March 1st of 2025, but Melissa went ahead and brought it over from the engineer's office now, so.
Okay.
Motions to sign.
Move.
Move.
Yeah.
I'll move.
Okay, thank you.
Second.
Tim?
Yes.
Roger?
Yes.
Fred?
Yes.
The next one is the Board of DD chiller contract with Garmin Miller.
And I'll move.
Second.
Fred?
Yes.
Tim?
Yes.
Roger?
Yes.
All Tim, I've heard an awful lot about them. They should be good.
Good.
Have we used them very much?
I don't think so, but
I don't recall.
I don't remember it. But
choice one coming, and normally they have all of that, but it doesn't say choice one,
Yeah,
so.
that's best we have one, just in case they don't,
Okay,
because it goes back and forth.
you ready for Tammy?
She here?
Yeah.
Yeah, sure.
I can go on.
You don't come in here. I got the invite sent to Mrs. Gray.
Oh, okay. Thank you. Good
Good
morning.
morning, yes. How is everybody?
Good, how are you?
Good.
Didn't it blow away coming in today?
No, but it is freezing out there.
Okay.
We see each other many times at soccer games.
We're done for the minute, right?
We're done, yeah, we're done now for a while.
Yeah. I think you guys got the annual report, but I brought a copy over in case, just in case, and then I brought the updated.
Thank you.
Yep. And these are just one pagers I found in case anybody asks you about the levy, you have just a small tidbit of information to share. People just don't know what we do, what advise.
How are you?
Good, how are you doing?
Nice to see you again.
Yes. Alright, yeah, so, just here again, I think you have had the annual report, but, as you know, the annual report is just a brief
Yeah.
synopsis of the work we did in the previous year, but it does have all of the financial breakdowns in there, in totality, and then by county, our collections and expenditures, and then this report really gives you a lot more detail on what services are here, in the community locally, so it talks about our school navigation and the schools that we're in, and the number of students that we've served, and our daytime crisis response, and, yeah, just any details around any of our primary programming. Yeah, I am gonna talk a little bit about, in here, though, I just wanna be clear, thank you, that, this is reflective of the investments of, funding towards individuals that uses local levy dollars. It is not reflective of the number of people served in your community that have Medicaid or third-party private insurance, because we don't have access to that data. We do have access to the Medicaid data for the first time, and I was reviewing that, well, we review it all the time, but I think that overall, for Hardin County, while we still see that, the overdose presentation to, local hospitals and primary care physicians is higher than the state average, the trajectory is going in the right direction. So we are seeing it go down, but it is still, higher than what we would like to see it based on, our neighboring counties and across the state.
Have you experienced or heard that while the opioid is going down, heroin use is going up, or other drugs are going up?
Yeah, so I would say that drug usage is very hard to gather data collection on, right? We definitely know that prescription opioids are down because everybody's monitoring that, even us ourselves with prescriptions that are delivered in our communities. But as far as who's using on the street, we see about the steady same amount of people coming in for treatment. So really our only marker is those that are presenting overdose or having passed from an overdose.
And some of the data, that I shared, I know, Fred, you were there for that, and so was for the drug overdose deaths in Hardin County. That was from 2020 to 2022. So what changed in that period is the prevalence of fentanyl, which is much more potent of a substance. And I do know that from attending a different meeting with the coroner, that 100% of those deaths within that time frame at least one of the years within that time frame were fentanyl related.
Yeah.
So the potency of the substance changed, which changed not necessarily using habits, but the lethality of that
The
substance.
results, yeah.
Right.
But, to give you good news, so like from 2022, we had 120 Hardin County residents present to an emergency department having overdosed. And in 23, it's at 81, with just a few months to go.
Close
So,
22.
120. So we do see it going down. We also see your overdose numbers going down. So I think that, that's reflective of, of everybody, right? Everybody's tackling it in one small way from one angle or another. And I think that's the only way to do it. Treatment isn't gonna be enough. Law enforcement is not going to be enough. It's getting into the schools and they're doing their part, educating and making services available and informing young people about the dangers, and we're doing our job trying to educate the community and get more service providers down here. The courts are doing their job with their specialty courts, which you have always ran an amazing specialty court down here, so that's good news, but we are doing a lot better with that, even with our treatment providers. One of the new, we got two really new exciting programs. One is with Hardin Memorial Hospital, which is, they've been a great partner. It's a little difficult to explain, but I will try. So we have, and this went through a lot of legal oversight, but what we have in place is we contract with an organization that has access to our data bank and Medicaid data bank. That organization now, by diagnoses, if a person presents to Hardin Memorial with suicide intent, attempt, or drug overdose, it triggers that they share that data with this data bank. It gets bounced off the other two data banks, and if there's a common face in there, the board is notified. Then we reach out to the provider who's treating them to say, hey, your person presented to the emergency department, you need to follow up on them. And if they're not attached to a provider, then we send our outreach team out into the community to try to get in contact with them. And that's because we know that's the most crucial time frame to try to really make a difference in someone's life, is once they've been in a crisis and they've reached out and they've shared it with somebody, they need someone to follow up with them to try to get them connected to services. So we have that relationship with your hospital and Joint Township. We're trying to work with, get the same thing established with St. Rita's and Michael Memorial. But we were super excited. We got our first preliminary report because it is fairly new. And we're also able to, those patients that present to the ED, we can, we don't get specific patient information. This is all data pieces that match up until we identify a person. But we can identify the zip code and where those people live that presented there, so we know where to do some interventions and marketing and education. I think, let's see. So last year, 120 patients presented to Hardin Memorial Hospital with one of those three diagnoses. And it was very interesting, only 5 of them were attached to a provider that we have and through our system. So that let us know that there are people, as you alluded to earlier, that are in trouble, either with some suicide ideation or substance use, and they're not connected. And so our goal is to get them connected, because as you know, treatment does work, and so we're very happy about that. And then we also invested in a notify application where, and we're marketing it right now, I should have brought those and we didn't. Partnering with our local health department, Hardin Memorial is coming on board right now as we speak. There's Yep. Where users can sign up, family members can sign up, stakeholders can sign up, and you just sign up, It's not a website, it's not an application, but when you sign up, we control messaging that goes out to the people who are signed up through their phone. It's just a text message. Because we've partnered with the State Highway Patrol, on a couple different programs, we know when there's been a large interdiction and the drugs are gonna be scarce on the street, which puts a lot of people into a crisis, so we notify out that text way to say, hey, if you're in trouble, here's where you can get public detoxification, if it presents an emergency room, this is how we can follow up with you. We get alerts from the health departments when there's overdoses that have presented that are above a threshold. And, so then we send those notifications out, which is letting users and families, whoever has signed up, saying we probably got some bad drugs on the street. But we also send out a lot of information about where services are, if there's an event going on, where you can get access to Narcan, if we're, like the overdose awareness event. And so it allows us to try to get as much information as we get from the state about what's happening out there down to the people who might be directly impacted. And so every week we see more and more people signing up on that, so we're very excited about it. And then the last thing I wanted to just bring to your attention, in case you had not heard, are you familiar with Senate Bill 318?
No.
That was, proposed by Senator Antani out of Montgomery County?
No.
Okay, well, I can leave you a copy of it. The, bill is suggesting that the commissioners have the authority to disapprove a mental health and recovery services board's budget if the commissioners do not believe the way in which the local funds are being used in their community, and also empowers them to assume the responsibility of the budget, meaning the Adams board can make no payment of public dollars, and the commissioners would assume that responsibility until an agreed upon budget could be developed. So, the history behind that is,
You say this is House Bill 318?
yep, House Bill 318. Now, I've heard from, well, in Auglaize County, they have not heard of the bill either. In Allen County, she reached out to your, association, did not feel as though it had a significant amount of support behind it, but I just wanted to give you the heads up that it was out there. I mean, I'm really just passing rumor from what I've heard, but it's a result of a lot of pressure being put on an Adams board in a county to invest dollars in a new jail. And, the commission, there was disagreement as to whether that was a proper investment of mental health and substance use dollars. So that's my understanding of where that all resolved from.
Usually, these bills are the result of somebody not playing well in the sandbox.
That's exactly right. That's what I've heard, but I was like, whoa, I better let our commissioners know, because I'm not sure they wanna take on that role, and most of them have said, no, thank you, that would be
Yeah.
more work we're not interested in doing, but now you'll have it and be a little more prepared for your association, so. Any questions, anything you're interested in that we can give you more on?
I had some questions, just to clarify on the working with the multi-county and the opioid and
Oh, yes.
working through that system and
Yep.
paying for shots. I heard you mention there was, through a message or something, that there were some drugs that weren't covered by, the initiative you were moving forward with the multi-county, with the director, and I just didn't know if there was a list that, something that wasn't included on that list. My goal is to push it to the opioid list if it's opioid related.
Yes, there's
And
a,
get it funded that way.
yeah, there's a formulary.
Okay.
So that program comes with a formulary which identifies all the prescription drugs that it will reimburse for. And I can get that to you,
Okay,
but
yes, I'd like
I can assure you that the shots are on there. So that was my,
yeah.
and I apologize, I did not have any awareness that they were not using, so I did get a response from the state. Hardin County residents are eligible for the reimbursement
Good.
of that program. I reached back out to the jail administrator to say, what can I do to move this along? And I've not heard back from him, because I just got the answer from the state on Monday.
Okay.
So I reached out to the jail administrator. I don't, it did appear as though the state was going to be receptive of a budget adjustment, because my guess is when he put his original request in, it did not include Hardin County residents. So he gets an allocation for the year, right? Well, if Hardin County wasn't included in that request, then he will eventually run out of money, so the state appeared to be open to increasing that allocation.
Was,
Well, we pay directly for the bill, we get billed as a county.
You should not have been doing that.
We pay all the bills for medication, including the opioid.
Well, it is for mental health and substance use medications. So again, that formulary, it's not for every medication.
But it is for that.
But it is for mental health meds and substance use medication.
so looking at the list of those who are approved, is that just Marion County Jail? It's not Marion County, multi-county.
It is, so I have to be honest with you, this is pretty much a state-ran program between the state and the jails. Now I understand why they run it the way they run it, but prior to this situation, I was confused myself. When the jail applies for this grant, they are applying for all inmates. When they, submit for their reimbursement, the jail submits it directly to the state. They say, we've incurred $5,000, here's the inmates, here's their county of origin. Then the board who owns that resident by county, the state reimburses us, and the jail has to invoice us for us to pay them. And that's the reason, because these jails serve people from all over. So to ensure though that they're connected with their county board, they run the reimbursement process through the board. So for instance, Marion County will have to invoice Union County Board, they'll have to invoice Hardin County Board, ourselves, and their own Marion County Board, to cover all of most of who they serve. But they could be serving someone from Cuyahoga County, and then they would have to invoice the Cuyahoga County for the reimbursement that board received for their county residents. It's a little complicated. My guess is, in all fairness to the jail administrator, because that's why I asked the question to the state, because I didn't understand it myself. I'll bet he assumed that was only for Marion County residents.
Because you've not seen anything at all for Hardin County.
No, because I don't make the application, the jail does.
Yeah.
And that's because they were sending the bill to us and we were paying.
Yes.
Yeah.
And he's really,
Yeah.
truthfully, may not have known
Oh, yeah.
otherwise. I mean, it's a,
That's the way it had always been done, and so.
yeah, it's a complicated
Yeah.
A
thing.
newer director, I mean, within the last year or two, so he may not have
Yeah.
known.
Yeah.
Because some of them were let go rather quickly and probably never didn't pass anything along.
Yeah,
I was under the impression of talking with him that he wasn't even aware that Marion was getting it.
well,
The Marion jail was, but not the Marion Kent or Hardin Multnomah County, so I don't know. And I can
we're working on it.
That's
I'm
what I
am gonna make it happen, and I'm so
I
glad
appreciate it.
that, Olivia said something, cause I was like, wait, what are we doing? We don't need to be paying for meds in jail, there's a program to pay for that, for medications and she was like, no, they get billed directly, and I'm like, oh no, we're gonna have to back it up.
comes through here in our mail.
Yeah.
We have been approving it, cause
You sh- so-
anything you can do. to
well,
help us.
it's gonna happen, it's the
Yeah.
when. because
Now, so
it's
now it's
eligible.
in his court as far as Multnomah County needs to do the next step. Needs
That
to
is
make the
correct.
application.
Yes,
On behalf of Hardin County and Marion County.
that is correct.
Okay.
And the state has said they would be willing to assist him
Okay.
in doing that, but I wanted to reach out and speak with him first before we brought the state in, so we had our ducks lined up in a row, but Chris Nicastro from OMAS
And
is.
can they adjust for 24?
I have to ask, that's why I'm trying to even see if I can get us in, well,
Well, yeah.
are you on a calendar year?
Yeah.
Yeah.
Okay, our grants and the grant that the jail would have is on our fiscal year, which would be July first to June 30th. So we're on what we call our fiscal year 25.
Okay.
So I have to see if I can even get us in on 25 or if they have to pick us up on 26. But I thought Chris was very flexible to say, even though they've allocated all their money out, based on this understanding that, he would work
Okay,
hard to
good.
try to get us in
Good.
25.
So what do we need to do? Anything?
No.
Just-
I'll let you know
it's in his
when it's a green light and you stop paying.
Okay.
So-
Okay.
I mean, stop paying for the drugs that are eligible, yeah,
Right.
and I'll get you the formulary,
So we'll have some more yet this year,
I would say yes.
so we can stop paying them. Or will it not start till 25?
That's what, I have to get that direction from
If
Chris.
they
We may
pay
have to pay it to
monthly,
June of next year.
Possibly up to June, I'm gonna say it's a good chance no, but there is a possibility through
possibility.
June,
Okay.
yeah.
so today, if we get one today, we would have to still keep paying.
Yes,
Okay,
yes,
that's what I wanted to know for this year.
yeah,
Cause we'll have to budget for next year if it doesn't happen till June or whatever.
And to be safe, we probably want to budget at least a half a year.
yeah. And there, it is an allocation, so some unlikely chance that even a jail could run out of the funds that are available,
Okay.
to them. And then the commissioners would be responsible thereafter, but I don't think I've heard of that. I know, we have Allen County, which is a large jail as well, and they never ran out of their allocation, so.
I noticed on that list of jails that are participants of it, there wasn't very many counties compared to the whole state.
Right. Well,
There's a lot of people out there that don't even know about other counties
well,
or
I'm
haven't
gonna,
applied, I should say that.
that's where I think,
Okay,
it took us, and again, this is where even my lack of awareness, I think, it took us a few years to get Allen County to make the application to get going, so, but they didn't wanna initiate medication-assisted treatment in the jail. So you still have jails that aren't initiating that kind of treatment in the jail.
Okay.
So it could be that they just don't offer it in their jail.
I will look for that green light.
Yes, it's so much, right? All good things, but who can keep them all in their head and keep them straight, so.
Yeah, and you're, no offense, not meaning it that way, but you're just one area.
Yeah.
Can I imagine what all we have to keep running?
I can't, no, I can't, no.
And that's why sometimes it slips through the crack.
Yeah, but that.
Change of directors, change of
Yeah.
commissioners, change of,
Yeah,
that's the problem with Multnomah County and stuff
Yeah.
sometimes.
yeah, in all truthfulness, that would have been sent to the jails, they would have had, that's where it would have started. You and I, we're just pieces that have to come along with it, but we're not really the ones that can facilitate it, so.
Well, my goal was to get it covered by either the opioid hub or now this came up, this is even more promising,
Yeah.
I think, so.
Yep.
And this sounds to be the best way and the consistent way of doing it.
I agree.
So,
And I think that future forward, most jails, they're gonna, there's a lot of lawsuits out there about medical neglect, right? It is a medical condition and they're choosing not to treat it, and so there's challenges coming along with that. Every jail's gonna have to do it eventually, so knowing that they don't have Medicaid coverage, and you don't wanna put that burden on the commissioners, I'm gonna guess this reimbursement program will be around a long time. It's been around, how many years?
It's been a while.
7?
Yeah, that's probably a good estimate.
Well, I think we're on the right path.
I agree.
May not be till next year.
I know, I'm sorry about that.
That's okay, that's better than
No,
nothing.
that needs to be addressed, and that's the main thing.
Yes.
It's being asked.
Because I think if all else fails, so, let me throw this at you. If there's no funding this year yet, and I know this isn't your area as far as authority, could we still put this year's before the opioid fund, before theirs kicks in?
Probably, possibly.
Okay. So we still need to follow that route till that one kicks in.
Until the new route starts up.
Yeah.
Okay, so we'll get
Absolutely.
working on that route, and if you can continue with your route, we'll.
Yep.
Somewhere in the middle,
Yep.
we'll
We'll get her.
get it covered. Okay.
Do you know what you, locally, with the local funds, has there been a decision on how to spend the One Ohio money? I know potentially to support these medications, but is there,
You mean the local stuff? Yeah, we're basically looking at the medication thing here, like
okay,
Tim said.
so then when we get that covered.
We've
we
had
can
a
look
few
for
small things, but very small.
And I think we've been one of the few regions so far to submit to the state their pot of money,
Yeah, on a regional level.
so,
But
but
Yeah, I think, are you the only region that's been
Hmm?
awarded at this point? Our region, Hardin County?
You know how they kind of keep things.
On the website, our region is the only region that's final of awards.
Yeah. I think we've had some too. Have you heard anything about the potential of transportation services for Hardin County
So
to your facility?
So we do have transportation for Hardin County. Coleman, we fund a transportation service through Coleman Health Services. I did not, do we have that on here? Let me get that out, I'm going here. We do provide transportation, but it's obviously for mental health services or substance use services. But there is a group, it's been in Hardin County about bringing in a transportation service for all medical services, but I don't believe that we have been able to establish a contract. Cause we were looking at, Hancock County.
Yeah, it's a Hancock County model or something.
The Hancock County is saying,
Yes, the,
that'd be the HAPS system.
what is WOCAP?
I know what you're,
Action.
it's their action commission.
Yeah, their action.
Community Action Commission.
Yeah.
Yeah, that's what they have.
HHWP.
Okay,
Yeah.
yes.
Yeah,
And so, you know, right now, Hardin County is part of that group of transportation also too.
Okay,
So you may be hearing from them also regarding Hardin County.
okay.
Well, we're happy, we've been in those meetings, and I've expressed my support and willingness to, enter into whatever type of agreement's necessary to, of course, for mental health and substance use treatment services, but even today, we just had this 2 days ago, and police called me, and a gentleman in our emergency room, it was in Lima, but, he needed, somehow ended up here from the Toledo area. Needed to be returned back to a treatment facility there, and we just called Coleman and they transported, so.
They know that they can call the Hope line, and that initiates that transportation service. It dispatches some other local services as well.
Okay.
And I think
And
when,
you say you currently are working with the Hancock County Transportation.
I come to those facts meetings. Yeah, I haven't made it to all of them, but I am present in some of them and have worked with the initiative to say we're, say we're behind you.
Yeah.
I'll put the transportation on for the next report, because we do
Okay.
transport, particularly your residents to like our crisis center, or I know Wings has them transported, or no, sorry, not Wings, but Lighthouse, to one of their other facilities, cause they're not offering the, how do I wanna put it? The administration of the medication assisted treatment, so the administration of the shot is done in another location, so we transport patients back and forth to make sure they can get there and get their medication, but.
Good.
Alright, thank you.
Yes, thank you.
Informative session this morning.
Yeah.
Good discussion.
Good, well, I'll be back next quarter with the
Okay.
next quarter's update, so have a great day.
Well, unfortunately, I will not see you next
Yeah,
quarter.
Roger, okay.
Well, I'm retiring at the end of the year, so
Well, enjoy your
my term's done.
retirement.
Congratulations.
just travel more than we do now.
Good for you. Good for you. Well, congratulations.
Congratulations.
Well, thank you for everything.
Yep, thank you
I'll
for
get to
coming
see
in.
you gentlemen next quarter then, huh?
Yeah.
All right.
Well,
Thank you, Candy.
Yeah, you're welcome. I'll
I'm
see
here.
you
We'll
at
see you
soccer
tomorrow.
field.
Nice to see you again.
Nice to meet you as well.
thank you.
How are you? Good. Hi.
So I missed the first half of that conversation. Could I know what was the topic here?
Just the services that they provide for mental health,
Okay,
recovery. She gave kind of an updated report on the last quarter.
okay. Can you give me some of the highlights of what was said?
I'll give you a copy of the report.
Okay, that'll work.
Yep.
Thank you.
I mean, they talked about the overdoses are down.
Mm-hmm.
You know, so they had 120 and 23, and then they're down to 81, which you can always watch the video.
Yep. You typically have it uploaded by end of day, right?
Yeah, I can try. Sometimes my computer's real slow, but generally it's down. they have this new partnership with, Hardin Memorial Hospital. And it's like a third party, and so if somebody comes in, so 120 people last year, or is it this year? No, came into the hospital, and they kind of get flagged if they're part of another provider system.
Mhm.
And so if they come into the hospital and they're part of another provider, then it sends a message to their provider to say, hey, somebody you have is in the hospital, right? So then that they can come and provide services for them, right? Because they want people to come support them. And they found out last year that they only have 5 people. So of your 120 people, only 5 people were connected to a group, you know? So that means they need to get, they would send out resources to those people that didn't have additional providers to provide them support, right?
Mhm.
So there's not a lot of people out there who, because the risk is when people go to the hospital with suicide or drug issues, overdose, that then they just go home. You know, they don't get any additional help. So they're gonna try and capture more of that. So that was a big deal. They talked about House Bill 318, which is not approved, but it changes the financial structure of the mental health board. And then there's this whole thing with the medication in the jails. So some jails, sounds like ours does it maybe, that when you come in with a drug overdose, you know, you can get on mental health medications. Not all jails do that, but then there's a cost involved with providing that. And they're looking at funding, so we have an opioid funding that comes down through the
Well,
courts.
Yeah, the course.
So they're looking at trying to pay for some of that medication through that funding for this year. And then they've applied for this grant from the state program to provide funding for it. So, you know, that's kind of the highlights. You can watch because there's a lot that they talked about, so, which is not necessarily what was there.
Yeah, that's just numbers.
Yeah.
When you're finished with that, I'd like that.
Yeah.
Just in
Yeah.
case.
No,
Oh,
absolutely.
that's right up your alley, Tim.
I think they did, it was just like,
Yeah, because it should be covered within so much time.
Hi, Keith.
Good morning.
How are you, Keith?
I am well this morning, how are you?
We are ready whenever you are.
Is it on?
Not a whole lot to go over today, besides the spill, or the fire and the spill. That's been completed, the actual cleanup's been, taken care of out there. Went out a couple times and discussed with them. I got a phone call the night after I sent the report to you guys, so it was interesting, because it came from, the state EMA, and they advised me that they were gonna be sending a large oversized load with a new generator or a substation outlet on it. Well, I went out to the substation because it was supposed to have been shipped overnight, and when I came back in and checked the next day, there still wasn't anything there. So I checked with AEP, and then they said, well, we're not sure what we're doing with that yet, because we think these might still run, even though they were on fire for quite a while. So I'm still trying to figure that one out, because OSP was supposed to be tracking this load all the way here to let us know if we needed anything moved or changed or done, and nothing happened with it. But anyways, that burned for quite a while. It was better for us to let the chemicals burn off of that than to try to put it out, because that substation itself does not have a ground. So that means there's always static electricity going through those wires and through those towers as well. And it was more of a risk to try to put it out than it was to let it burn. We ended up with 9,000 gallons total of mineral oil that was out there. However, we're gonna estimate about 3,000 to 4,000 was what the actual spill was, because it did not affect both of the transformers that were there, only affected one. So we got fortunate on that. We're still not sure what sparked the actual fire itself. I know we had a storm go through earlier, could have been a possibility, could have been a lightning strike, we don't know for sure. And I'm not sure they'll ever figure out what caused it. Those transformers are old, they're in the 40s, so they've been around for a while, and they've definitely done their duties out there. But it was interesting, sat there with Instant Command for quite a long time, watching the smoke, which way was going. EPA came down, they actually did air studies throughout the entire city and around the area where the smoke was going. It was coming back negative for anything health effects wise. We were only at a health issue 1 on the smoke anyway, so what was burning, because it usually burns pretty clean, just a dark smoke. We just let it burn and burn and burn, and we had pretty good flames out there, probably about 30 to 40 feet up into the air most of the time, burning, just depending on the wind just kind of kept swirling that day. So we're a little concerned with that, because we were hoping to keep pushing it away from that other transformer, so it didn't overheat while we were there. But with that, that's completed. Now we'll just wait on them to finish the final reports from the EPA, and get that submitted to the state for the CERC stuff that we had a spill with a fire out there at the AEP substation. We did get the final report back from the spill center on the actual train tractor trailer. So that's been finalized and done. All the bills have been sent out with that. I still think it might be a little bit of mitigation going on with that. Just because I know 2 of the bills have not been paid yet to the fire departments for their services rendered on response. So we're still waiting on those 2 bills to come in from them. But they were submitted, and I think once that's finalized, they usually get paid right away. Let's see. Already went over the update on the possible ideas of us doing a donation center. Sheriff has not gotten back to me if they've decided to go on with that process or not. But they know what's expected. That changes daily, so I told him I'd keep my eye on the North Carolina Public Safety site to see if there's any changes on what the needs are. I know there was one county that was wanting to start accepting some space heaters and kerosene heaters because the weather started changing. Some of those people still don't have access to new furnaces and stuff like that yet. So I'll keep an eye on that for him. The commodity study, that was completed, of course. I did send that to the LEPC for them to distribute. I haven't quite seen an email yet. I'm not sure if you've received an email yet, but I would assume that it should be getting sent out soon to everybody within the LEPC from the study itself. And they did a pretty good job. I went through it, looked at it word for word, and looked at it, everything that they studied here, and they did a pretty good study. They watched a lot of vehicles. Gives us a better idea a little bit about how the chemicals are moving through the county, which helps us out quite a bit, knowing what our busy intersections are, where they're not, and what we really need to be watching for with that commodity study. With that, I did make contact with the, in reference to the insurance stuff, and the email that was sent. That email was not sent to me for the commissioners to redo the actual renewal license for the insurance stuff from Circuit sent straight up. I think Victoria received it, or somebody received it here. So I did talk to her about that. She did send me some information and stuff that she was looking for. And the building, I didn't have a list of all the buildings that we had, and they did provide that building list with me. Because that was one of the main questions, was one of the buildings was almost completed that we were building. I didn't know anything about it, so she sent that to me, and I can able to look at that building for them and get the inspection done. But other than that, that's really about all that's going on right now currently.
Okay.
Did you send in any information on loss control for your budget for next year?
On loss control?
Yeah.
I have not sent anything from loss control. I don't even know if I received the actual loss control
The green bars.
budget. I received the EMA, but I did not receive
Should have been with your EMA, should have had 2 sheets there.
I'll check it and see, but I don't remember seeing loss control, I just remember seeing the EMA and the LEPC, because I gave the LEPC theirs.
Yep.
So,
Yeah, if you can double check for that, because we need that in so we can start the budget process.
I will double check. I remember having 2, LEPC and EMA, but I don't remember seeing loss control in there.
And check with Mike too, cause he's the one that brought him down here to us.
Okay.
But you don't have it.
Yeah, if you can't find it, Mike's the one to generate
I will,
another one.
I will check with him. Anything from you besides?
How was AEP work with, I know
Excellent.
there was
Excellent.
a lady that was going around.
Yeah, she came in to do the main consult for any public questions and stuff that was coming in. I was dealing more with the higher ups that were dealing with the actual situation out there.
But,
They were very good, very cordial, stuck around, waited on both myself and the EPA there before their main person left and put in somebody else in charge, and they did really well.
Good.
I've worked with them before off of some of the stores on the smaller side.
Good.
Yeah, excellent.
Good job.
Yeah.
Your part and everybody else.
Mhm.
A lot of services were needed that day, so.
We did have one incident during that, with the drone. Oh, we couldn't tell where it was coming from. It came from quite a ways.
Yeah, wow.
So, we were trying to track it back in and it's coming straight toward town and we had no idea where it was gonna go from there.
New technology
Oh,
helps.
yeah, they brought it right in. It was right up above the fire and.
Oh, well.
Mhm.
I think that'll help in many situations in the future.
Mhm.
Don't hesitate to use it, so call for it. Anything else?
Carpet, people were out meeting this morning, so I'm sure that's some progress soon. In the doorway, they started installing the framing and stuff on it.
Okay.
So it was cut out and our guy started framing it the other day.
Slow but sure.
Slow.
We'll get there.
Somewhat slow.
There's a lot of things to do.
As long as you get there.
Yes, exactly.
That's the
Yeah, it's amazing how many little pieces have to come together or wait on something else for the little rooms. They're important. Yeah, nice facility.
Yeah, hopefully it ends up being a nice place.
Anything else?
I don't think so.
All right, thanks, sir.
You're welcome.
Thank you.
And that is your copy.
Oh, okay.
Thank you.
Yeah, I'll read that.
There's a lot of chemical names in there.
Yeah.
We listed, so for our information, we went through and put all chemicals in there. So even the ones that are being carried by our local places in there, but we did not put anything in identification to where those chemicals are.
Yeah.
Just for our knowledge, when we look at it, so we know if a chemical pops up, we can see that on the list, we know it's there, and it'll reference us into our direct thing, because we didn't trace it. So, it made it very nice.
Good.
See you guys, thank you.
Yeah, you.
Right back. Gotta run up to Hardin Hills.
Oh, yeah.
bill for, Donnie Doll's flowers. $26.33 a piece. Total was 79.
2633.
26. Okay.
Hi, how you doing?
Doing all right. How about yourselves?
Good.
Hi, John, how are you?
Doing good. Doing good. Busy week out here. Sounds like y'all have a busy day too, so I'll give you a moment if you need it. Otherwise, we can
No, we go
try
ahead
to
and
jump in and
jump
get
right
as much
in.
covered as possible.
All things are.
Thank you, Mark.
Yep. Fortunately, collecting for funeral flowers.
That is unfortunate. Necessity, you know, someone has
Past
to.
commission or past committee.
It's unfortunate.
Okay.
Okay. Are you all ready to go?
Yep.
Okay.
Tori's ready.
My name is Jack Kramer with Invenergy LLC, as a representative of the Renewable Development Department for the Hardin Solar 2 and Hardin Solar 3 energy projects in West Hardin County, Ohio, just south of Ada, near McGuffey area. Coming in to provide a general update, be responsive to any questions, comments that you may have, and get any action items, points of contact that we should be reaching out to as we continue to move forward. General update, when I came here this time last month, I communicated that likely by end of October, we would be pursuing commercial operation for Hardin Solar 2.
Yes.
That is still the case. We actually just yesterday finished our final SCADA testing, which is basically all the electrical testing. So all the final certifications are in front of Invenergy, in front of Res. They're under final review right now, with the intent to sign at any moment. I don't know if that's necessarily going to be today or tomorrow, but it's going to be happening here in the very near term. And so that's kind of the first big milestone that we have, which is when we hit that final completion. And that is as it relates to producing energy, being comfortable with putting that into the grid, working with PJM, who's the regional transmission operator, to accept that energy. As it relates to some of our other, I guess, operations milestones, there is site substantial completion, which I think is what a lot of the township trustees care more so about, which is when is Res going to be complete with all of their reclamation work. So once we reach this COD date, then we are allowed to do final site reclamation. So that is the refilling of all the detention basins, that's the reclaim of any of the laydown yards and so on. That is actively ongoing at this moment and will not be complete by today, tomorrow, but we do expect that to all be completed by the end of the year for Hardin Solar 2. We got confirmation from Res that the final punch list, we have an internal document where every single block, every single parcel has certain locations that we are flagging. Those locations, like I mentioned, we anticipate being remediated, reclaimed, getting final sign-off and approvals from individuals by the end of this calendar year. So we're eagerly looking forward to that. This will be a joint discussion as it relates to Hardin Solar 3, but in discussions with a lot of the township trustees this past week, this previous Monday, the question remains around the RUMA and around the timing for road had hopes, this spring, in spring of 2024, that we'd be able to get to a lot of those road repairs this fall, doing a very, I guess, clean, very tight, follow-up of when we are complete with area A, then they can go and repair road A, and so on. We had hoped, that was gonna be the case. I think that there's a little bit more activity in the area than we had hoped this late in the year, provided it's already end of October, obviously looking into November, and anticipating a general winter unavailability for a lot of that road construction. It's just not an ideal time for that to happen. It will be planned for next spring and next summer. Something that specifically myself as well as our construction team are going to be working with the county engineer's office on getting a clear timeline. I know that that's been something that they want to see moving forward, which is to sign off on all the proposals, all the amounts, and then like I mentioned, those dates where we can feasibly start construction, weather pending. So that was made very clear by the township trustees this past week. That's something that we are actively going to be working towards through the end of this calendar year. Again, that's something that we want to have wrapped up by the end of this year to make sure we have a full scope planned out and expected for 2025, because that's when
So
probably the
they,
biggest pain point.
they know that's gonna be 2025 before they see it on the road.
Before those road construction are completed. The challenge, I think, with the staggered construction is that a lot of the same roads that were contemplated for Hardin Solar 1 and for Hardin Solar 2 are also being utilized by Hardin Solar 3. And so ideally, if that, wasn't the case, we would have repaired all the roads after Project A and it would have been fine. And then Project B being separate in different roads, you can repair those after completion there. But because for Hardin Solar 3, we were still utilizing a lot of these roads into the late summer and fall and even now early winter, they made it a lot more difficult to make a decision to move forward with those road repairs, knowing that there still might be activity that would potentially disrupt some of those construction efforts, add costs, make the project last longer. So we felt like it was the best use of resources to wait until 2025 when this construction is truly winded down. I had mentioned this as well in our last meeting, but we do expect significantly reduced traffic on site. All of the major equipment has been delivered. We have achieved mechanical completion for both phase 2 and phase 3, so there's no inverters, right? Those are probably the heaviest pieces of equipment. No large truckloads of piles or modules or anything else that are coming into site. There will be trash removal and general equipment removal. Some of our subcontractors might still have equipment out and, throughout site that are going to be removed, but in terms of what's there, it's present, so there's not going to be any additional heavy equipment or materials moving into site. And as mentioned, with the final completion expected through end of year with Hardin Solar 2, and likely going to be early spring, if not very early summer for Hardin Solar 3, where we have all that reclaim done, weather pending. Again, we recognize some of those action items are a little bit more difficult during a rainy season. So pending March, April ground conditions, we will move forward as soon as available. But we're kind of just anticipating another wet spring that doesn't allow for all of that work to be done, right when it's warm enough. So I would say probably by the end of quarter 2, or you can say end of half 1, 2025 is when we comfortably believe we'll be done with Hardin Solar 3 completion. But again, very reduced traffic in those locations. As it relates to the Hardin Solar 3 commercial operation, right, where we have mechanical completion, we have energy testing complete, and we pass around those final certifications that will likely be end of February, is what we're currently tracking, and I communicated last month as well.
End of February this year,
Of
or
2025.
2025.
So that's the general construction updates. I will address pilot in a second, but is there any questions as it relates specifically to?
Well, I guess one concern that's been brought up before on these projects is to maintain our bus routes through the winter, that they're safe. And now that we're not being completed in fall and question will be to the engineer and that, and your company is assured good roads for picking up and dropping off school children.
Mhm.
So is there any plan to, I guess, make sure that happens? That no road is tore up during the winter now?
So, the existing conditions, to my knowledge, again, with the limited construction activities going forward, they should stay as is. Obviously, there's going to be, you know, other commercial, trucks, there's going to be agricultural equipment that's still going to be using these roads. So I can't say for certain that they're not going to be impacted further, but to the extent that the conditions exist is what we would expect to see. Obviously, during the winter months, you know, they'll deteriorate if there's pressure, right, from the cold, if there's trapping of moisture, whatever else. My initial response to that is we don't have a full plan in place, but it's certainly one of those things that there is a road bond set aside with a pretty substantial amount of money. And I know the proposal is not finalized, but in the initial estimates that were passed around, it was well below what we had posted for that bond in terms of coverage. And so I won't speak on behalf of the county engineer's office. I think they're the ones who have to provide the end all be all or some type of agreement with the townships themselves. But I don't see any issue if there would be like patchwork required in certain locations that can't be contemplated as part of our repairs now.
Have you done patchwork on going through the project?
To my knowledge, there's been certain patchwork that's applied, but I can't speak on the extent or exact locations at this moment. We can pull that, data though, but.
Well, it's not something that you haven't done before, so if a
Right.
problem comes up in the winter, you'll be able to address it.
Yeah, it'd be similar to if there was, I don't know, maybe after a large weather event, I'm thinking, for an area that's already been under a lot of pressure, duress, that all of a sudden it like gave way, maybe it was like the side of a road or a berm or something that wasn't built up to standards and it was quickly addressed. Because there are certain locations I'm sure that we weren't able to utilize during our own construction because of the equipment we had, let alone buses or other individuals, and so, again, I don't have an exact record of all of that on me at this moment, but I'm sure that that's something that can be shared and compiled.
That's just the concern if we go another year and keep not getting roads
Yeah.
finished, I should say, they're under construction, they're always being repaired, but that's another year where school year we have to go
Based
through.
on what I'm hearing, I would think that we would, pretty much during the course of 2026, I'm sorry, during the course of 2025, have everything in place and pretty much be done. I'm assuming you're working with the engineers right now on getting everything taken care of too.
Yeah, and I don't know if he's in at this exact moment, but literally following this meeting, I do want to connect with Luke Underwood. The trustees specifically had indicated this is kind of his project to maintain and manage, so, and, you know, I'd share with you all, I want to make sure this is done in the winter time, so that way we have months worth of notice prior to spring, prior to summer, because he communicated to us this, last spring that they need to, you know, make sure all the materials are available, make sure that they don't have other projects going on that would impact their own schedule and so on. So we want to make sure that we're aligned with the schedule forward.
And again, with the mechanical completion that you have right now with Hardin Solar 2, you anticipate Solar 3 to be what, in the springtime?
Yeah, mechanical completion for Hardin Solar 3, again, weather pending, is probably going to be in the early spring. A lot of that final completion is more subject to the electrical installs, and so the perimeter fences, the piles themselves, the access roads, those are all built and complete in that regard. It's a lot of those final electrical connections, it's making sure that everything is running properly, so there's going to be testing ongoing. A lot of that work requires, you know, special tools or more detailed work, usually not being able to wear gloves, and so during the winter time we wouldn't want to subject any contractors or, employees to long hours.
So based on that, my thinking is, tell me if I'm wrong, but
Mhm.
my thinking is that everything should be in place to allow for the completion of the roads in 25.
Yes, certainly.
So that by this time next year,
We should be all
it should
wrapped
be
up.
completely 100% complete.
Yep, that's my expectation, yeah. So, that's what we're currently targeting. Again, working backwards from step one, in order to achieve that, we have to have a firm plan in place by this winter. That's our understanding and expectation to have with the county engineers. And then, it's my understanding that we need final approval from the townships for those respective roads and portions or segments of roads in their respective townships, so, we will keep them engaged as well. So pilot is the next big thing, both as it relates to our ongoing compliance and partnership with the county engineer's office, with, the township trustees, local fire and EMS. It was made a point of emphasis last time that I was here that Hardin Solar 2, we move forward and make sure that we are communicating compliance with all of our items as soon as possible, recognizing that we need basically final approval, for our qualified energy project status prior to March of next year in order for the 2026 tax year to, receive the pilot payments. We are certainly pushing for that. We have, two outstanding pilot compliance items that we do not have completed this time. One is the Roundhead Fire and EMS sign off. We are working with them, aggressively to make sure that they believe they have all the training that they need, all the equipment that they need. We are working to provide a distilled emergency response plan to them as well as the broader community, which I communicated we would share with you all, once available, because we want to make sure that Kenton, as well as any of the other surrounding areas that might service, the communities that we're involved with, in case they don't have the bandwidth, the equipment, whatever else that folks can provide. And then the second item is the final sign off with the county engineer's office. And so, working with Luke Underwood and his staff to make sure that, like I said, we have this proposal moving forward for all of our compliance to be submitted. It's my expectation that we have everything complete by the end of November on that. And once we have everything in place, we will immediately submit, to the Department of Development for, review. Hopefully that gives them about 4 months.
So you're anticipating working with the Department of Development this year on Solar 2?
Yes, this year. We, similar to, your interests, want to get this wrapped up in a nice clean package to them, to give them the time to review as soon as possible. As mentioned, we, by end of November, expect to have all of that in place. We're having an additional training for Roundhead by, it'll be November 23rd, which is a Saturday. We're going to be turning over the distilled ERP, within the next week or so. We're putting some final touches and getting additional feedback from a lot of the firefighters themselves to see what they want to have, and making sure that we have everything set, like I mentioned, for that training. So
You're looking at paperwork turned into the DD by the November of this year?
yes, that's the plan as of right now. So working eagerly to make sure that that's.
And then I'm assuming then that, for Solar 3, there would be the same thing completed in 25.
Yeah, so.
Submitted to the Department of Development.
Yeah, so likely, I'd probably say a month after, our substantial completion, for Hardin Solar 3, we would miss that March 2025 deadline, I would assume, just because that's right around the same time we're trying to complete everything. And I don't think that's enough time for them to review everything, in order for approvals for 2026. But we should have more than enough time to get that all submitted prior to the 2027 tax year's deadline, which would be March 2026. So I think that's the honest expectation for phase 3 pilot payments is 2027. And as it currently stands, barring any delays or, slow feedback from the ODOD, it would be 2026 for the tax payments, but I don't wanna jump the gun on that until we feel very, very confident that that's gonna be the case. I know with Hardin Solar, there was some setbacks, so I don't wanna over commit to anything until we're absolutely ready there. But again, we're working our hardest to make sure that those tracks, and if I need to provide like a Gantt chart, I guess, if you will, or something for kind of like where we expect to be with construction completion, where we expect to be with pilot compliance for each of the projects, and then what year those would take shape, I can do that, if that would be helpful.
Okay,
Sounds like it's progressing well.
Yeah,
Good
certainly
summer
progressing.
work.
Yeah, there's a lot to do still yet, but we are, I think following the delays of Hardin Solar 2, we, hit the ground running hard, and we're trying to make sure that we're, running straight. So we're excited with where we're at, we're excited for the county, and, again, keeping tight correspondence with the township trustees. They've communicated and we've responded that we're gonna be, in attendance at all the meetings for the foreseeable future. I wasn't able to make the fire and EMS meeting in person last Thursday, but I did put out a call to Chief Helton, who oversees that meeting, as well as some of the other, fire chiefs. So, and we've been pretty bold about saying, please pass our contact information along to those that have any questions, comments, and please reach out. So, yeah, I think I've covered everything that I wanted to cover, at least in the immediate term. Open to any feedback or questions, comments that you all have.
And again, just to verify out as far as DD goes, with the submission of paperwork according to that, would make it, eligible for the solar 2 during the tax year 25. And as it's planned right now for solar 3, it'd be in 26.
Correct, the submission.
Tax year 26.
Yeah.
I don't have anything now.
Help us out a little bit. You introduced a new gentleman the other night at Roundhead.
Yeah, certainly. And this, I guess, I'll take a step back and explain kind of how Invenergy operates. So, Invenergy has, we have two, under the Invenergy umbrella, there's two departments, if you will. So there's Invenergy LLC, and then there's Invenergy Services. And Invenergy LLC, in the, I guess, layman's terms, is more of like the commercial arm. So I am basically the point person, the point of contact for the county, for the landowners, and so on, up to a certain point in the project, usually around very late stage construction or commercial operation. I will still be with Invenergy. I will still be a relevant point of contact through probably the summer of next year for the Hardin Solar projects. But once a project becomes operational, we have an asset management team, and they manage assets. Invenergy owns about 80% of the projects that they develop, with the intent to continue to be a community member, participant, and owner of those assets, because we've seen challenges with other developers, maybe developing and then selling the project, or developing but not building, or owning the project, and so on. We still operate Hardin Solar 1, that's still under Invenergy Services, and we plan to own and operate Hardin Solar 2 as well. So Derek Levan was the gentleman that you briefly met. He is the Hardin Solar 1 Operations and Maintenance Manager. So our Hardin Solar 1 Operations building on 65 is, we have a full service staff there that's available from roughly 9 to 5, Monday through Friday, in person if they're not in the field, but available within the area. And so he's going to be basically the point of contact if there are any emergency issues, if there are any questions related to the solar site itself. He's the one who works with AEP. He's the one who works with the fire and EMS folks, and so on. In this package with just still the ERP that we're going to be sharing, it's going to have roughly 5 or 6 contacts for the operational side of our project. So there's gonna be the asset management individual who again deals with more of the commercial side of things. So they're gonna be the one who is responsive to a lot of the landowners following our kind of final site checklist, right? So we have everything currently in front of us right now. It's my responsibility, my team's responsibility to close those out. And then ideally the project sits quiet for 30 plus years, and it's that person's responsibility to maintain the relationships going forward. So you'll have their contact information, you'll have Derek's contact information, and again, that's the guy who's there on site, 9 to 5, more of a technical role, so he's more akin to the electrical and civil aspects of the site. And we have an administrative assistant, her name is Teresa, who's also out of that building, 9 to 5, who will likely be the one to receive the phone calls to the building itself. When people reach out, she receives all the mail, so I can make sure that the mailing address is provided in that ERP as well, to the extent you don't already have that. You probably have that somewhere in writing from a couple years back, and
Probably.
I think it's very necessary to make sure that we refresh a lot of these touch points. So that was the individual.
So he'll be the one, pretty much direct contact with the owners
Yeah,
and the township,
yeah.
the county.
And the whole point of bringing him around to those meetings specifically was to give a face to a name, because
Yeah.
Roundhead had a much less of their township was considered for development for Hardin Solar 1. But for Hardin 2 and 3, there is a little bit more development towards the south area where Roundhead's more involved, and so they hadn't had any correspondence with him before. And so I made sure that he is available, that they know who he is, that they have the contact information.
And that he would be coming to the township meetings, et cetera.
Yeah, yeah. So I'm still gonna be running with the township meetings going forward, myself, Tyler Barron, the community affairs manager that is overseeing, Ohio. And Derek, in some capacity, we will work to attend all of those meetings over the next couple months. It's pretty tough with the triple stack, as you might be aware, to get one person to all 3 of those. So, we're gonna need some extra coverage, but, at least through probably March of next year, or until otherwise communicated by the townships that it's unnecessary, we will plan on meeting with them.
Can you get contacts, and maybe he has them, but to our EMA director, Keith Severns, the contact numbers and everybody who to contact, or
Yeah.
in case of.
Do you think that you could share his contact information with me so I can reach out?
Yeah.
Can you say what was Keith's last name?
Tori will get it.
Tori will take care of
that.
He's probably got a card.
Yeah.
But
That'd be
yeah,
much appreciated.
just so he has, when things go wrong, he's the first one to call everybody.
Okay.
So, or they'll call him, and then he'll start distributing, so. A lot of new numbers, a lot of new people,
Mm-hmm.
every project has their whole set of, so it just helps him to have when he's called from home, he knows who to call.
Yeah, and on that note, in speaking with some of the fire and EMS folks, they indicated making sure that there were updated addresses for all the entrance points throughout the project, making sure that all of our, anything outside of the fence line, we do have electrical cabling, making sure that those are, the as-bills are provided for 811, so that way when a landowner or a contractor, makes the call in, that they can identify and flag and stake those locations. That's something that our operations team can do as well, so Derek would be the individual. If the county engineer's office, let's say they had some work that they needed to do out there, and they said, hey, we know this is ground that you all have, can you stake out those locations? That's something that we can do to help his team or another utility or whoever it is. So we're making sure all the bases are covered. I know there's a lot of requirements that we are meeting anyway, but I feel like those are ones that we should speak on and make people feel, the additional comfort that we're doing our diligence, making sure everything is covered, so. Thank you so much. That'll work. But yeah, again, open to any feedback, comments, individuals that have questions that they want to hear from on a formal or informal basis. there are a lot of trustees, I think, that live near or within our project area, so they have a balance of both, you know, professional questions and personal questions that we wanna make sure are addressed, and so on, and we're open to making sure that those are answered, so.
Okay, anything else for Jack?
I think, no.
Appreciate you coming in.
Yep, absolutely,
We'll see you near the end of the year.
well, I was gonna ask if,
So
what you
we're
guys.
anticipating seeing you here in, the end of November, to give us some good news.
Yeah, hopefully so with pilot information. Are these offices specifically going to be open the week of Thanksgiving? I usually come in on Thursdays, and obviously that would be,
We're closed Thanksgiving.
I would assume so. I'll call into the office and see if
Yeah.
they're available.
Right, yeah.
Maybe even move it back a week.
Yeah, first week of December, yeah, whatever works, I'll plan to call in November just to see, and if I don't have any informal updates for all of you to provide, then I'll just set up a more formal appointment, so.
Okay.
Yeah.
Very good.
All right,
Thank you.
appreciate the time,
Yeah.
as always.
Thank you, Jack.
Absolutely.
Appreciate you going there Monday evening to those two townships.
Yep. I'm glad you saw me there this time around, at that one, and Tyler covered for the McDonald Township meeting that I wasn't able to.
Thanks
so.
for coming.
Yep, absolutely.
Thanks, Jack.
Thank you.
Yep.
Is Luke coming for this bid opening? Okay. We are assuming he is coming here for the bid opening. If he was gonna go out and try to find him, might as well just stay here, cause I think he's coming here.
Based on what I found tax year, 26 tax year, you should see
Bid opening and all that.
That's a problem.
I'm gonna wait that.
Okay. Just don't hide my mail over there.
All right, I'm just slow.
Right by it. Worse than ever.
How's Fred today?
Good, how you guys doing today?
Not too bad. Too bad.
Let's see, we got one more Saturday here at Ada,
One home game, yep, this week.
and John Carroll.
Yep.
And they're ranked in the top 25.
They are, I think they're 25th. So
I
we
think
have a
they are.
chance.
I think they are ranked 25. So if you come around like and say hi, cause I'll be checking tickets.
Okay.
Should be there anyways.
Yeah, we got two away games after that. So
Yeah,
two
and
games
that concludes the season. He ran for Hardin County Fair King.
Yes.
And I remember interviewing him back then. He's a good kid, you should be proud of him.
Yeah, the business school at ONU is
It's
really,
pretty.
really good. I mean, their job placement's 100%. So, it's pretty impressive.
Good morning. How are you?
Yep.
Think you got a few of them.
Yeah, big three. It's always good. Hope you guys keep the pencil sharp.
Find out.
I'm surprised Luke isn't here.
He's out there.
You out there? Shut the door, won't let him in. Okay,
We're at 11.
it's 11 o'clock, Mr. Underwood.
Ready?
Good to have you with us.
Yep.
Okay, we are here for the bid opening for Hardin County Roads 175, 190, 29, 55 asphalt resurfacing project. I think you got these projects shorter names.
The longer they make it more expensive.
The first bid is Kokosi, is that how you pronounce that?
Yes.
Okay. And we should have a bid bond, oh yeah, they got it labeled, there's a bond. We have subs, is there an estimate on these?
Should be a tab in there.
Oh,
Oh, I've got an estimate.
Yeah.
The estimate's 3.3 million.
oh, there's estimate. $3,341,015.19.
Yep. I think it,
You just. Okay.
down to the penny.
Yeah.
Now, there are subs listed, do you need that information, just the total? There's two totals.
Yeah, there should be.
Let's see, first total,
Well, it should be a subpart,
It's like the last pages.
before those.
There was just one total at the bottom.
okay, there we go. Yep, the modified total. Total is $2,698,165.16. 2,698,165.16. Next bid is from Shelley Company. I know these are expensive projects, because they're thick.
Yeah. It's federally funded, so we have a lot
Oh,
more
yeah.
paperwork has to.
Okay, let's see. They have the bond submitted. And the dollar sign is $2,743,051.91. 2,743,051.91. And our final bid is from Shelley and Sands Incorporated. passed on all of these. They do have a bond. Bid total is $2,469,345.86. 2,469,345.86.
I have, two, oh, go ahead.
Do I have a motion to accept the bids and refer them to the county engineer for recommendation?
I will make that motion, accept bids, and refer them to the county engineer for recommendation.
Second.
Any discussion? Roll call, please.
Tim,
Yes.
Roger,
Yes.
Fred.
Yes.
I've got 2 hours to report the parent load to ODOT, and I'll do that, and then I will prepare a bid tab to everyone to look at. All right, thank you. Thank you, guys.
Thanks for coming in, everybody.
So,
Back in envelope.
yes, please. 2 million of that is CSTP federal funds.
That's a lot of road.
500,000 OPWC, and 129,000 is,
And that was the last one, that was
loan through OPWC. So it'll be mostly funded for,
113.5 miles.
that's 26 miles.
It's 26 miles.
Yeah.
It's,
Should be, it's 25.49, I believe, 6 miles, 170, of County Road 175, 7 miles, County Road 190. I don't remember the other mileage.
Okay, that's what I did.
Yeah. It's just short of 26 miles. Hot mix overlay. 175, 190, 265, and 2.
You guys don't look at them, I'm not gonna flip back the envelope.
And so this is, this will be done in the spring of 25. Completion date of June of 25. So,
Early in the year.
yeah.
Is this part of the 25-mile grant?
Yep, federal funds, yep. 2 million of it will be federal funds, CSTP, federal funds, $508,971 of OPWC grant. And then we've got a loan portion in there through OPWC as well, and then the rest will be local. But I think the OPWC is percentage driven, the CSTP funds are guaranteed 2 million. So we may not get all that OPWC grant because it's percentage driven. So we'll still have to, there'll be some local money involved, but not a lot.
Yeah.
Good.
It'll be good.
It's worth the effort.
It's worth it.
Paperwork.
Yeah, it was, so right now I'm applying for 2031. Because I am gonna try to, this is the first federally funded paving project we've ever done in Hardin County with CSTP funds, so it was good. But I am gonna apply for another round. I applied for last round and didn't get it. But there'll be some counties drop off in next round, and we were close, so we should get another round like 2031 then. So another $2 million for paving.
By then, $2 million is gonna go probably half as far.
Right, yeah. If you got a minute, I'll give you an update. Reed Road, we're gonna be close to.
That's good.
Okay.
I saw that we got,
Got our first.
Steve, you got more
Steve,
discussion with the engineer.
so it's got that taken care of like roads.
Yep.
Say that so we can get that on record.
Okay.
Are you ready?
I'm ready, sorry.
Yes, Steve submitted his first invoice, for the installation of
Yeah.
that. I sent it up to the.
Yeah.
Yeah, it's all built.
We haven't got an invoice from NCI yet, but they're almost complete with the installation of the actual plant.
Okay.
We've got an electrical subcontractor coming in either tomorrow or Monday to hook the electric up to the plant. We're waiting on a manual to get delivered, but we should get real close to maybe switching over next week.
Oh, wow.
So we'll have some final grading and remove the old plant, so a couple weeks we should be done.
And again, with
Regrowth.
Good.
Yep. We're still looking at end of November or first of December for Eldridge.
Okay.
But they only take a couple weeks to install, so theoretically we could still have that one done before the end of the year.
Okay.
There may be some lag in billing, because you know how that goes. But anyway, so that's the update on those two. The material storage building, they're pouring the approach slab tomorrow, I believe. So that's pretty well gonna be wrapped up here next week as well.
Good.
And we had paid some invoices on that, they're down to probably just one more, and that one will be closed out.
Good.
Okay, yep, I'll review these, I'll get a recommendation up to you, because it's federal, it's, you know, we got a lot of other hoops to jump through to get it approved, but it should be all set to go then for spring.
So these are two different companies, Shelley?
Yeah.
Yeah, Shelley
Have you ever
Sand and
dealt-
Shelley Company.
Have you ever dealt with Shelley Sand?
I've
never heard that name before.
They did bigger projects like this, so there's an MBE requirement, because it's federally funded, 7%, they have to use a minority business, 7% of the total. They do a lot more of that type of work on bigger projects where they have to do that. So, yeah, the numbers were I was expecting, I was kinda hearing that the numbers were gonna be good, but I was surprised that they were that good, so. $3.3 million project was coming at 2.
Especially Shelley Sand.
Yep. So, yeah, that was good.
Is, we just talked with Jack Kramer and Energy.
Yeah. I haven't seen him.
He was sitting in the middle of the.
Okay,
floor.
I did walk by, okay, I did.
Yeah. So,
Okay, I'll talk to him.
base with you.
Did he say anything about road?
Yes, that's what I was talking about.
Perfect,
That's what he wants to talk to you about.
because I was gonna reach back out to him.
He's been to a couple of township meetings this week.
Okay,
We're not gonna get through it this winter, apparently, or finish.
well, I've kind of been on him, it's difficult to do road work during the winter, so
Yeah,
it's gonna have to
he
be
acknowledged
spring.
that.
Yeah,
Yeah.
So
Just
it's
maybe some
next-
touch-ups here and there.
yeah, to get ready for winter, yeah.
next spring.
Okay. Good,
All right.
that's all I had.
Good. Thanks, Luke.
All right, thank you.
Thanks. Slide those down.
Yeah, I need to look through those, so.
Yeah.
Yep. It's right up here. Yep, that's the subdivision there. I believe, let's see, is that there? It's right here.
Going down the hallway,
That's where the bank's at. It's back behind the subdivision.
And then it's
I think there's 14 on, and that one. 14,
Well,
18.
I think we're done till after lunch.
No, I get them all backwards and which one's going and which one's not going, and I'm like, I need to know where this one is so
Yep.
that I can keep them straight.
Yep.
So, okay,
That's that one.
sounds good, thanks.
Okay, thank you.
Well, that was quick.
Yeah, geez, this is a solar file. And then I got it for map wise.
I know, it's just like with, these sewer plants, I can't keep them straight because you don't know where they are. And I was like, oh, especially with the other, now finished. So the guy in here talking, they own and operate the solar fields.
They construct them, he does. He's the head of the constructing part, once they're finished, he's passed off to a
But it's
different
still
division of
Invenergy.
Invenergy. It's all Invenergy, but it's two different divisions. One's kind of the construction, one's the operation, and then like the solar one then got sold off to AEP. but Invenergy remains as the operator.
Okay.
So Invenergy makes some money that way too, and they continue to operate it for AEP. And that's probably what'll happen to these other projects as they complete.
So AEP, but AEP buys the power, do they also own the field?
Well, they do in Solar One. They've purchased the.
Because I had heard that sometimes they can go through several buyers through that build process. And it sounded like
Sometimes,
this was a
yeah,
little bit more
sometimes they're just one big company. This is online, you might, it's probably been updated. You can
Oh,
get
yeah, you
online
showed me
or-
that one,
Yeah,
I didn't
it's,
know how to mess with it. Oh.
shows you,
Okay, so the Hardin.
give you that one, that's a black and white one, but you can get on and
Right, right.
probably
that
get it
Hardin.
updated with, this was as of
1, 2.
January 24, but our projects are kind of all listed on here. You see Hardin, that's Hardin 1, Hardin
Solar
2,
Ridge is-
Hardin 3, Center Ridge, Panther Creek
Not on there yet.
is on the same site. It's just now gonna come on here, that we have the green ones that are completed, which we have Hardin 1. Then you have some in different stages, which is Hardin 2 and Hardin 3. So these are due to be finished. Then coming online is Cider Ridge, which is under the turbines. I say it's under the turbines, it's not, it's kind of separate. And then Panther Creek is down by Ridgeway, it's just in the paperwork stage. So,
Okay.
but you can get on there
Yeah.
and it'll give you these, and then I think you can go to each project and get the layout that's been turned in, but so far Hardin 1 is the only one we get. We have the exact footprint from Mike to change the taxing.
Right.
So until he gets the final boilerplate or whatever the nameplate, he won't know the actual footprint of what property to change from personal property to pilot.
Right.
Once he does, then that's more of a map, but a lot of them have a map. Let me see if I can. I had a folder. On one, like Panther Creek, or they give you a preliminary map, but. This is, Pine Gate is the same thing, you call it. This particular
there's
project is
Panther
going to be Panther
Okay.
Creek. Yeah, this is what they pass out. This is the guy's name, but
Yeah,
that's,
he was out there at the fair,
yes.
yeah.
Most of them will set up out there, but it tells you, but this is their preliminary footprint. Is the blue circle.
Well, what's that mean?
Well, that's where they're gonna put their project, but it doesn't mean every square foot of that at this point is licensed in their thing. This is the general area, and here is Ridgeway. You can kind of look on the map. This is Hardin
Is this
County.
where their office is or something?
It may be, probably their
So they
connection.
don't tell, at this point, they don't tell you which farm, because the farms are already in contract at this point, right?
Right,
But they don't tell you that,
right,
they're just giving you a.
because that's private information.
Right.
But they
So they're
still
saying
could be
this area.
signing up people.
Oh, right.
So this is as of
Right,
this year, probably earlier in the year. is-
I see.
And,
So they're kind of soliciting this area.
yes,
For-
I think they're still signing up, but they're locked in at whatever licensing they go for with the highest siting board, whatever they end up, like if they get 150 megawatts, then that's all they can produce.
Right,
They can sign up everybody in the world, but they won't be able to produce more than that and put it on the line.
right,
So,
okay.
but that's kind of, this one is one of the biggest, 250. Or most, like Solar One is 100, 100 and a quarter. 150, somewhere around this. This one's almost double what solar one, maybe what solar one is, I think 150. That's on my list, I should look. Solar one is 150, solar two, which is Hardin two, is 170, then Hardin three is 300.
So how
It's
many-
double
So
what,
how many acres is this?
it depends.
Oh, they,
Yeah, it depends what they sign up, but, Panther Creek is like 1,800 acres, so, and it's a big one, so.
We are ordering in Michelangelo's. You interested in anything?
Sure.
We want.
Italian sub.
Okay.
So, yeah, it depends on how they're gonna use the land, how the land lays, what contracts they've done with what farmer. One certain farmer may sign up for half his farm. So then you're gonna have an area in the middle that's not Panther Creek. It'll be corn, whatever they wanna keep farming. So,
well, I figured they want it to probably be as contiguous as possible.
well, yeah, everything is close to the big overhead lines, the cheaper it is for them. That's why you don't see a lot of people running to northern Hardin County to put in a solar field, because all the main power lines are all cutting across the county down there. So they wanna be able to tie into that line. The cheaper it is for them to tie into that.
Right.
So,
Yeah,
the turbines are kind of over here if you're looking at where, oh, maybe that.
alright.
Oh, that's okay, I did it. Let's see, let's go over here. This may help a little bit, but, so you got Ridgeway, and this kind of helps with townships.
Sure.
And then on top of this, you have like the school districts, which makes a big difference on who gets the pilot money. If it's in the footprint of a school district, see, here's Ridgeway, so you kind of look at this, here's Ridgeway, it kind of shows you it's like this. So, and it could come down into another county. So, but they're kind of stopping north of Ridgeway, so, I mean, everything's kind of in here. There may be one or two that,
Right.
because the other counties don't like solar and all that, so usually they
Right.
don't get permission there.
To go that way.
So, but
And
it'll be mainly these two townships, maybe a little bit of Buck, but I don't
And
think so.
the other solar,
The others are over in here, solar 1, 2, and 3, kind of are all up. Mainly these three
yeah,
townships.
cause the Lynn has the windmills, right? Does it-
Most of them, yes. Taylor Creek has some, McDonald has some, but Lynn has the majority. Well, Lynn, the turbines will clear down to getting my highways. Well, they're down here pretty heavy.
Right, well, it's
So-
just Bell Center would be here.
But solar 1, 2, and 3 are mainly up here. The turbines and what's going to be Silent Ridge up here.
Right.
And then you have Panther Creek. It goes by different names, but it's a different,
Right.
Panther Creek's what they use for the project in Hardin County. So that's what it'll be, 250 megawatts. So at that point, then those lines cross, power lines cross like this.
Right.
So really, down here is probably the only place you're gonna have major solar development of big farms. You have littler farms wanting to come, Dudley's coming in to talk, but I don't know if that's on solar or not. I just know the Dudley Township trustees are coming in.
Right.
There's some talk of a small project in Buck, but it hasn't went any farther.
Right.
I think there's people looked in Goshen and people looked in Pleasant, but you really don't, other than the turbines up by Ada and Dunkirk, Dola, you got the 30 turbines up here that are up there, but, so it's kind of the big power lines. Now, as these opportunities get filled, they may wanna pay the extra price to lay more line
Right.
if they want in Hardin County,
I
but
mean, so Solar One's bringing in 900,000, right, pilot,
yes,
a year?
well, just about, yeah.
So you'll
Most
get a
of them
little
about, yes.
You should get a little bit more for the next,
Yeah, each one is 9,000 times this number, so 150 times 9,000.
right,
150 times 170, or 9,000 times 170, 300 times 9,000. So as they get bigger, or the bigger ones, but about a third of that the general fund gets to keep.
right,
The other 2/3 goes to any county levy
right,
that's in the footprint,
right,
or a county, well, I shouldn't say that, I should say any county levy like 911, Board of DD, they're not in the footprint, but they'll get part of the pilot.
right, cause county,
But the schools and fire and EMS have to be in the footprint, big old footprint of the project. So they have to be, say this circle is the project, there has to be the school districts that are in here and the percentage of the land that's in their school district. Say a third of this is Ben Logan and a third of it's Ridgemont, or 2/3 Ridgemont, and Ridgemont will get 2/3 of the school
right.
portion. of
Now,
that.
is that change, I don't, cause I know they came in and talked a little bit about the pilot changing,
Yes.
but these Solar 1, 2, and 3 should have the same similar types of,
Now they can change by the levies.
well, not the but the general way that it's distributed.
Yes, once it's set its footprint.
Cause they were talking that maybe that was gonna change, like the one guy was saying that the pilot was gonna maybe change for anything that's not, so like Panther Creek would be different than the ones that are already in the system. But I don't know that.
I don't
Then
know
you're
how
probably
they
there
would be,
yet.
well, there's two different ways you can do pilot now. And all of ours are the old way, or what I call the old way, and we've always stuck to that just to keep all even.
Right,
We didn't want one to have, but they do have, they can go through the state, get bonds for alternative energy, but that way they're exempt of all sales tax, which hurts our county, so we don't wanna
you don't wanna do that.
give them that at this point. So, but they can come file for it later.
Yeah,
So all our projects have been the one
the one way, yeah.
alternative energy thing, but,
Well, hopefully, once, all this revenue comes in these next couple of years, it'll make a difference.
yeah. Oh, well, yeah, you figure Solar 1, Solar 2, Solar 3, Panther Creek eventually, Side of Ridge, wind and solar, they're all roughly 900, 1.2 million per year per project, so, as long as they're operating. So,
Well, as long as they're operating.
so 5 years from now, there should be 5 or 6 major projects.
Well, right, but then you're guaranteed that until they're 50 years or 40 years.
Well, or they quit producing.
Oh, I thought it was
And then they gotta be
guaranteed even if
decommissioned.
so it's
if
just
they're-
until decommissioned?
They're sitting idle for, I think it's a year, then they have to start filing for decommission.
And then it goes away?
And they have to clean it up and go.
Well, I mean, that money, I guess I thought when the one guys came in, that even if they are not producing, they still are on the hook for their contract.
Yeah, they can be unless they decommission. Then they take everything out and then there's no more pilot. But what would happen then is the land goes back to personal property tax.
And then it goes
Like
back
they
to a
have
regular
to change
tax.
it back, yeah, regular tax, which is far less than pilot.
Right,
Cause
Right.
I think it was like 60,000 on one area or whatever it was, Solar 1 or something, I have to look up the figures, but say it was, the land that got exempted was bought the county like $60,000,
Yeah, a little bit less than that.
the personal property. In pilot, we got 900,000 for that same 60,000.
Right.
So there's a great difference, a big difference in doing solar for.
Sure.
And back then, they didn't even have the Senate Bill 52, they just, people did their contracts and we just got to say what we wanted to pilot. Now, Senate Bill 52 is give us some say in some areas, we can't do incorporated areas. Like the city of Kenton has their own say, we don't control that at all. But there isn't really anywhere to put a huge solar field in the city. We got 50 acres out there, the county could put in a 50-acre field, but the city has ordinance against that, so.
Now, somebody was saying something about the wires, do you know in your contracts if they have to remove the wires that are underground, or they just remove the top
Well,
pieces?
it depends on the project and what the contract is, but like the turbines, they, if I understand it correctly, when they put those in, they put a 20-foot by 20-foot cube, basically, of concrete, 10 foot down. So they do not have to remove that if they ever leave. They just have to put 10 foot of dirt back over it
Right.
so the farmer can keep. So I'm sure there's tiling and wiring, but they're supposed to clean everything up and put the tile back and everything. And the state holds bonds on that, and the problem was, I guess not a problem, but the first ones we did was like $1 million bond for solar one. Well, now they're holding like $3 million a bond, because I think they realized they didn't want somebody just to say, okay, keep my bond, I'm just leaving. You have the mess, here's your $1 million, because it'd be cheaper to them to just, so we've had to up it. To like, the bigger the project is, the bigger it's gonna be. So, we're all learning as we're going, and Hardin County is one of the leaders of that, where a lot of counties have just decided to ban it. You know, it's just easier, but for us, for a county that doesn't have a great amount of new income, we don't have big factories coming in or anything, we gotta do something, because as our cost of living goes up. You know, the 1 year they went up 10%. Well, Hardin County really had no new revenue. Luckily, Solar One come along.
Our general fund last year from 23 to what we have, we're now running on 24, that general fund went up 14%.
Yeah. So so this is kind of built 2 years out, Solar 2 and Solar 3 and all these, but in 2 years, we're probably gonna need it.
Sure.
And the problem is 20 years down the road or 10 years down the road, we're going to be relying on all this pilot money, but there's not gonna be any new pilot projects.
Right.
At some point, the county would be full or all solar panels.
Well, if you consider, it gives you a buffer of time.
Yeah.
You get some money in the county, but
Buys
you're
the
still gonna
county-
have to do some long-term,
Buys the county about 10 years.
yeah. Right.
10 years inflation will eat it all up. And if any of them pull out, we're in trouble.
Sure, sure. Well, and hopefully they clean it up and get the land back to where it's usable.
Well, hopefully in the next 10 years, we get a factory or something.
Right.
Ideally, be a factory to make solar panels.
We need alternatives where we can
We self-serve ourselves, you know, but we had a company interested at that 50 acres out there, but
Oh, they told us nobody was interested. They told us
well,
nobody
it was a
was,
far reach. It was a company from India, was checking all over the country. So for a spot, and they checked here, but it was something I wanted to build by the end of this year, and they were gonna put in 700 employees. But when they found out we don't have 700 housing units, you know, we were gone.
right,
That's one major problem, we don't have housing.
right, the
And no one
workforce.
wants to invest and build here. we've tried a lot of places, but, till you get that contractor that wants to come in and build, you know, you can build all the jobs in the world if nobody lives here to work it.
Yeah.
And that's another, you know, entity or another side of the story, so.
Well, no, it's a uphill battle, I'm sure.
That helps. Let me look through here. I might find footprint
Yeah, no,
of
I'll
any
go
of the
out to
other
the
projects.
website here and,
But that's a high power board site.
yeah,
Go to there and then you can bring up footprints
yeah, no,
of
that's
each
great.
one, because this sheet pretty much has their case number, their size, their date, and how far along they are.
Do you guys know if the 1 o'clock meeting with the health department is gonna be executive session, or is it open?
I don't know.
Don't know.
I don't know what they're coming for.
Well, it says funding, so, money, money, money.
Money, everybody wants money.
That's
to come
right.
in the door.
That's right,
It's just how they want it. But I really don't know myself.
yeah,
Uh,
okay.
Probably the biggest drawback on solar has been bond issues, school bond issues,
Yeah,
because.
You guys are
there's
still
been
working on that
entity of
one.
tax that pilot money doesn't include. So if you have a bond issue on your school and you're in one of these entities, the people that are signed up for the pilot
they don't pay.
don't pay your bond issue anymore. So, and a bond issue is collected, say you collect $1 million, is what the bond passed for. Okay, 5 years down the road, half of it gets exempt from solar. Now half the people are paying that $1 million.
Right.
It's not split, it's not exempted, and then pilot pays the difference. So
Right.
our issue has been, and I've kind of worked on, is with the school districts in the footprint to get with these entities. These entities can make payments or help pay the bonds, but we can't, commissioners can't. So we've kind of hinted, sat them down in groups and hinted that you guys need to work something out around us, because we can't do anything with it, but that does exist.
Yeah,
So, and we even talked to Senator McCauley and all that, and there's provisions for the new pilot to
But
make those payments, but not our way of sticking with the old. There's no provision.
right,
So, like USB, when Solar One went in, I think they had 2 years of a bond issue left.
1 or 2 years out, it was minimal. It was-
So
it
they
didn't
went
really
ahead,
impact it.
they went ahead and paid it and just ended it.
Right.
Like Ridgemont, they have a major bond issue still on. And it would be Kenton too, but Kenton's not in one, solar project, maybe one field, but. So we gotta work out something, because especially around Ridgeway, if everything around Ridgeway goes to pilot, they're exempt. Everybody that lives in Ridgeway will now have to pay that $1 million divided by how many people they are.
I know,
And
that's
then is
hard.
that right? I don't know. We didn't make the laws. The state legislature made those laws. But they don't wanna correct it. They said it'd be too hard to go back through their Senate and House and pass laws and correct it.
Yeah,
So we're like, well, wait a minute.
right,
You're penalizing the people. So there are, hearing some complaints as Panther Creek comes along and gets farther in the process of people in Ridgeway are not happy.
sure,
So, but all they can do is go to Panther Creek and ask them to pay the bond money. And I think they're willing to do that, but ultimately it's not our authority, it's not the
Right.
commissioner's authority to do that, because they've signed their own contract, so,
Right.
and we don't have the authority to go make them pay the bond issue. So there's always a downside to, so far we've had projects that didn't have large bond issues till now.
Which one's first one, really?
Oh, we got till 1 o'clock. Hey. Still got some rain. Streets wet out there. I got some.
I'm gonna go get my lunch a little early here, and we'll be back at 1 o'clock.
Should be here.
I wonder how the auction's going.
Yeah, started at 10.
Yeah.
Yeah. I don't know how long it was gonna last.
Well, I don't know.
Couple hours at least, I'm sure.
Hopefully they get a good crowd.
I want to thank you for letting us come and talk to you today, and just to explain why we're here today. We are here to formally ask for your financial assistance to support Kenton Hardin Health Department and its services. Our department vision is keeping Hardin County healthy by improving the lives of those we serve and strengthen our community through a collaborative partnership. We offer services that benefit all the 30,000 plus constituents that you represent, regardless of age, race, ethnicity, or social economic status. Some of these include hands-on clinical care and education, ensuring safe drinking water, swimming pools, eating establishments and septic systems, and investigating, when asked, nuisance complaints. Our emergency preparedness coordinator is continuing to educate himself and teaching others in the county about emergency scenarios and how to respond to them if they occur. Securing the ARPA funds for Kenton Hardin Health Department would be essential in enabling us to continue to provide these and more services and care that our community residents need and deserve. After reading most of the U.S. Department of Treasury 2022 final rule for the recovery fund, I learned that one of the main funding reasons is responding to public health and its workforce and the negative economic impacts of the pandemic. Unfortunately, COVID is not going away, and differences and strains are occurring all the time. Our most recent epidemiology report showed that between September of 2023 and September of 2024, Hardin County had over 800 new documented cases, and we know many cases go unreported due to self-testing. So how did we arrive at this negative financial situation besides the pandemic effect? This is a multifaceted answer. This year we have experienced several unforeseen and unpredictable events that dug deep into our available funds. The board has also made decisions to not request or increase subsidies that we received from the townships and municipalities since 2019. And by trying our best to make do and be good stewards of their money, we have learned that that was a mistake on our part. We also learned that status quo has not been the best business action plan. We need to improve our decisions and be increasingly proactive to support long-term growth and opportunities. The health board ultimately takes responsibility for those decisions. The other factor was that Kenton Hardin Health Department always relied on grants for revenue and funding. That resource is changing in availability and dependability. So just to summarize, Kenton Hardin Health Department is passionate about keeping and growing the services that we offer to assist in the health and wellness of the residents of Hardin County. They call it home, but we realize that it can only come to be with additional financial assistance and funding from you, the county commissioners. Again, thank you for letting us be here.
And here's an official, sorry, I'm dealing with bronchitis, an official proposal.
Okay.
I didn't know if I needed to read it or if you guys could just read it.
Copies in there?
Yeah.
I can help her read it too if you would like her.
Yeah.
Oh, you got 3 copies?
Yeah, there are 3 copies, yeah, if you would pass her out.
Did you want me to read it?
What's that?
Did you want me to read it?
You don't have to if your voice.
Okay.
Is it possible to have it read out loud?
Yeah, I can read it out loud.
That would be great.
Yeah, I'll read for Dion here. The Kenton Hardin Health Department's vision is to keep Hardin County healthy by improving the lives of those we serve and strengthen our communities through collaborative partnerships. Our health department staff protects, maintains, and works towards improving all of our county's residents. We serve approximately 31,000 county residents of all ages, race, ethnicities, regardless of their socioeconomic status. The Board of Health is requesting $414,500 of coronavirus state and local fiscal recovery funds as part of the American Rescue Plan for COVID payroll expenses and working for retention of compensation. The U.S. Department of Treasury stated providing local, state, and tribal governments the resources needed to fight the COVID-19 pandemic is a core goal of the coronavirus state and local fiscal recovery funds, as well as addressing the other ways that the pandemic has impacted public health. Our health department has provided services to prevent and mitigate COVID-19 and other diseases to the general public, businesses, and nonprofits. From 2022 to projecting through 2026, the cost of payroll expenses of Kenton Hardin Health Department's public health employees' portion of time spent responding to COVID-19 equates to $354,500. This is the amount that has been and will be absorbed by the health department's general fund. Through the COVID-19 pandemic is over, the requirements and demands of mitigating our response to COVID-19 are not over. The payroll expenses calculated are for our nursing department and front office staff. COVID-19 has become part of those staff members' daily job duties. The reported cases of COVID-19 are 17,005 for 2020, 4,382 for 2021, 2,072 for 2022, 802 for 2023, and 846 currently through September of 2024. Though the numbers of reported cases have drastically gone down from 2022, there has also been a change in the way the numbers have been reported. Late 2021 to present time, home COVID-19 tests are only reported on a volunteer basis. The reported cases from 2022 and on are only including those positive cases that were tested at a healthcare facility to the Ohio Department of Health. For 2022 and estimating through 2026, the daily tasks in dealing with COVID-19 for our nursing and office staff include the following. The nursing staff regularly monitor the Ohio Disease Reporting System, which shows how many cases of each reported disease in our country are given at any time. In 2022, our staff provided contact tracing to people that developed COVID, to provide guidance to patients who tested positive for COVID, and to inform people that they were exposed and advise them to quarantine. Our staff has provided guidance from the CDC and the Ohio Department of Health to local congregate facilities to help prevent the spread of COVID-19 to their residents. Our staff were and still are in communication with local schools to try to assist and provide them with guidance that we're receiving from the CDC and the Ohio Department of Health. Our front office staff fields daily calls regarding the COVID vaccine. Our nursing staff give regular COVID-19 vaccinations. Since 2022, the health department has received regular shipments of COVID-19 home tests that staff are responsible for distributing. The number of COVID-19 home tests received are not determined by our staff. Therefore, the number of tests that the health department receives is usually above the number needed on hand for residents coming in for a test. So staff members are tasked with calling local agencies to get those tests distributed before they expire. Our health department can utilize coronavirus state and local fiscal
recovery funding through the American Rescue Plan to support and strengthen our health department's ability to continue to deliver critical services effectively, as well as to bolster our public health workforce. Through the nursing and office staff face daily interactions with COVID-19, and other department staff have been affected by COVID-19 as well. With work being interrupted to help with COVID-19 response, the Board of Health's total request for funding, $60,000, is for working retention compensation. We want our health department to continue to be able to pay staff and provide them with quality benefits, and for staff to be able to continue to afford working at our health department. Your financial assistance is vital to ensure that our health department staff can continue working to provide health-related services to our community and to feel supported and appreciated and like they are making a positive difference in the lives of our residents here in Hardin County. We also need more assistance to ensure that we can continue to have our office open to the public. On behalf of the Board of Health and the staff of the Kent and Hardin County Health Department, we thank you for your time and consideration. Being granted our request of $414,500 of coronavirus state and local fiscal recovery funds as part of the American Rescue Plan is vital for the health department to continue to operate and to serve the county's approximately 31,000 residents with quality, and I'll add sometimes mandated services.
How long a time period do you see that $414,000 covering?
I would say at least 2 years.
2 years?
2 years.
2 years.
In our discussions, 2 years has been the time that we feel we will be able to implement a sustainable plan for the health department to continue. So it's gonna take us some time to get to a stability level. Yep.
I think, Roger, I think that the board, I've been on about a year, we've recognized that there's both a short-term issue and a long-term issue. Relying on grants for funding worked for decades previously, but as grants are drying up and not becoming reliable, as Dr. Anderson said, it's going to not be sustainable. And so we've recognized that, but we've been trying to just keep our heads above water for the last, since I've come on the board fiscally, and before we're trying to work on implementing a long-term plan. But we need to do both, there's no doubt about it.
The assessment that you have to the subdivisions in the county, have you approached Mike Bacon to see if that could be amended so that you would collect more next year? I don't know what his deadline is for that, or whether it can be amended.
The township subsidies amount that we get.
Yeah.
I have questioned Mike and Brad Bailey, and they said that once the budget commission approves the 2025 budget, that is set, and that cannot be redone.
I was thinking that if you could give it an
Yeah,
amendment
I was
in.
wondering if whatever you submitted, maybe you could get it a year early, starting in 25.
I think Mike said no.
Because I know that you've got, even if you amend it next March when you have your joint meeting, you're not gonna see the first time of it until March of 27.
Yeah.
So,
It looks like in your history, what you've indicated here on the third paragraph is from 22 to 26.
Yes.
That you've incurred, payroll expenses of $354,500. So I look at that as a 4-year time period.
Yes.
And that in this money that you're asking today for 414 will only last 2 years. I'm a little bit
This
confused
is not
on
our
that.
full staff. And looking at the details of the ARPA funding and what the grant allows, I just went for the calculation of what we spent those years that we did not get reimbursed from any COVID funding, but was COVID related for our nursing department and our office staff. So that's not our full staff.
So that's not a full staff?
No.
Okay.
I was going by the final rolling for that and looking at, cause when Brad presented it to us, he said to look to see what the grant would be able to cover for you. So that's the approach I went with.
so you got some COVID funding?
Yes.
And that's not included in?
Yeah, my understanding
That's
was
not
you did get
included.
COVID funding and that you have spent it all.
Yes, all that we were given. $350,000.
All that, how much did you get?
It was over $350,000.
And some of that was for supplies and stuff too, or was that
Yes,
all? Yeah.
Some of it was for supplies, not all of it was for salaries.
Yeah.
And some of it we had to buy specific items.
So you're basically saying you're gonna need at least for 2 years, 400, each year, $200,000 on average. And that includes what? What's the breakdown of those expenses?
Primarily, a lot of it is salaries, to cover a lot of our revenue loss that with COVID, what our funding we have lost or grants that we have lost.
So salaries, you're saying?
Yes,
So 100% salaries?
I would say yes.
What are you gonna spend for other things? How much money is that gonna take? You know, you've got normal expenses.
Right, and looking at our budgets, and looking at this past year, like what caused us to go into, hopefully, we do know that we need 10,000 next year. We have 10 desktops that are at the end of their life. And we've got our normal expenses, but the bulk of it has been salaries and, with how many turnover we've had and how much we have lost. We are looking at.
I know you keep a close eye on the expenses and everything. What percentage of your total expenses in a year's time is salary versus what is everything else? About 65%, 70% salary?
70%. I wanna say 70% at least is salaries, and with the insurance cost, especially how that has gone up through the years.
Quick math, about 15 primaries.
I wanna say it's well over 80, but it's looking, with this quick figure, it's a lot more. The bulk of it is salaries.
How much money do you anticipate receiving from the subdivisions in this period of time?
It's 75% salaries. 75% salaries and benefits.
75%, okay,
So, yeah.
that makes sense, that makes sense. So how much revenue would you anticipate in this time period from the subdivisions?
We get $265,500 a year.
How much?
$265,500 a year. Right now, that is our largest revenue income. We are planning on getting, about, 150 to 200,000 with workforce grant. That is our second. Our immunizations have gone down greatly. We are working on trying to get those back up, and our vital stats have dipped also.
So again, the grants is how much money in total for a year?
Just the workforce grants, we are trying to get some more grants. Our workforce grants, average about 200,000.
How much?
180,000 to 200,000. Or 150 to 200,000, but we've been relying heavily on them.
180,000,
Average, yes.
Okay, average, okay. So in a year's time, you're getting from the subdivisions 265,000. You're getting 180 from grants. And From this, you're looking at 400 divided by 2, about 200,000 from here. So that's basically saying you've got about a $600,000 budget.
Yes.
Am I thinking correct in here? 645,000. If I add those three numbers. Does that make sense?
Yes.
Can I ask why it wasn't until you didn't have enough money to finish out the year that you waited till now to come in?
We've come
We
in
have,
before.
when Kirby was here, we have
Yeah.
come in.
But, I mean, it wasn't this urgent a request and this massive of a response. You know, it's a lot easier to fix things when you got more time before you run out of money. Instead of a knee-jerk reaction, you can do a little more planning and budgeting.
I think the expectation or reliance on those grants we talked about previously, unfortunately led everyone to believe that the fiscal issue was maybe not as dire as it really was, because traditionally, past, I don't know the history of the past, but it seems like they would roll in timely fashion by the end of the year, by end of a operating quarter, and they just didn't this month.
Our last workforce grant was paid out 3 months late, 2 months late. Through
So
the Ohio Department of Health.
combination of not paying them or paying them in non-timely fashion led to this, so. Prior to that, it seemed like expenses were consistently being met by that workforce grant. So your point is well taken, but I think that was the main reason, my
And
understanding.
maybe we need to be more specific too. I don't think we ever come to the commissioners unless we think it's dire and important. Otherwise, we would be handling it ourselves. So, anytime we've come here, I don't think, and maybe that's a misunderstanding. I know you guys get a lot of requests, so yes, it's very different, but, definitely when we make plans to send people over here and request things, it's because we need something that we don't know that we're going to be able to pull off, so.
The workforce grant as well, it's only guaranteed for another couple of years. We're not sure if that's gonna be renewed or not, so that's something we can't count on in the future. I think with the funding here, if we were to get that, that would sustain us through that time period to restructure our funding cycle, what everything looks like between the townships and whatnot, and then get us on some level ground.
And I think your situation just reinforces what we have said in this office for years, is that you never wanna base salaries on grants, because grants go away, and then you've got a position that's unfunded, and you're, you know, that's where you're at right now.
Yep. And we have a fairly young board, so I know there's been a lot of talk of what's happened in the past, but gosh,
Yeah.
70–80% of us are looking at this with fresh eyes, and we're very serious about changing sustainability. We deliberately recruited Jordan knowing he had a financial background and knowing that was something we needed. So we are very seriously looking at what Dr. Fritz said, a restructuring.
So how soon do you think you'll have a plan for moving forward? Because we don't wanna keep throwing money across the street without you guys having a plan that you're gonna be back on your own 2 feet again.
So I believe that's where the 2-year time frame comes in. Like, the plan would be before that, we expect to be sustainable.
Yes, and
for 2
definitely
years.
meet with Hangsa Township Association, they have their meeting and go over, raising those rates, since they haven't been raised and going on 5 years now. We've got a couple different numbers in mind to get us
Yeah,
different.
so let's talk about that, because that's part of what
Mhm.
Commissioner Crow's talking about. You know, what sort of rates are you looking at doing?
Brad has given
I
us.
mean, I would say a specific rate, what sort of an increase are you looking at doing as compared to 265 annually? How much more are you looking at getting?
Brad, go ahead.
Go ahead. There were some numbers kicked around, I think, between the 10% raise and then a 30%. We still need to kind of go back over those numbers, but I think we've kind of factored in or just some advice we've got from the prosecutor's office around the 30%, which would basically average is 6% a year, kind of with the running number on inflation, cost of living and everything. So that would definitely generate another 30%, so $70,000, roughly $75,000 on top of that from the subdivisions on what we're getting now. So.
Question I have is, so is this a fair question? Is this temporary for 2 years? So in 2 years, you'll be depending on your other funding source of trustees and city?
That would be the plan, to get ourselves on level ground and then kind of restructure our finances as we need to be, so we're financially sound moving forward after our 2 years. And then if there's an option for a levy or whatnot in the future, that's always an option, but that's not something we're looking at, especially at the time frame that is a while out.
Well, I would think if you have an ask in March, it'd be a year till you collect it. To get to March, we're 5 months out, so that's a year and 5 months. Then you should have your funding set, I would think. Just roughly thinking in my own head, it's probably since the last time you asked for more from your funding sources was maybe 20% since then. If, like you said, 20 to 30, I think you're right there somewhere, minimum of 20. That's gonna be an awful big hit for the townships and the city all at once. And they're gonna wonder why over 5 years you haven't come and asked. I know that's kind of beating a dead horse.
Yeah.
And we all see that.
You gotta remember that going forward.
Yeah, yes.
We can't put on this one and then say, well, we've
Yes.
done it, now we'll operate for a while.
Had that same increase been incrementally over the last 5 years, you wouldn't notice it as much.
Sure.
Or they wouldn't have.
Long time to digest it, yes, agreed. Unfortunately, that wasn't the case, and
Right.
here we are today.
And I know, I just wanna kinda get my mind straight the situation. Cause you have a funding source, you just maybe hadn't used it right, or as best as you could. And so now you're asking for the county to get you to 2 years?
Yeah.
Out?
And then at that point, you'll be okay.
That's our hope, yes.
That's our goal.
Yes.
Are your sanitarians, is their position funded by fees? Do you charge enough fees to pay their salaries?
Just sanitation, yes.
There are some things that don't come out of those.
Right, nuisances, animal bites, and tattoo, they have to go to tattoo shops for their licenses.
Plus.
You want me to elaborate? Yeah,
These are
so
stipulated.
I'm required to do cost methodology on our programs yearly. The idea behind our fees is that we have just a little bit of a carryover going into the next year, because if we have too much, then the state will tell us that we need to look at refunding operators if we have too high of a carryover. So I do those year to year. If the increases are minimal, we basically leave them the same. So if there's only a $5 or $10 increase, we leave them the same. Last year we hired an SIT. That SIT's hours can now be put into our cost methodology, so the fees will go up. They're probably going to be going up anywhere from $20 to $50 per facility, per permit, per whatever, in order to justify what we basically had to absorb over the last year in her costs. So, but yeah, my fees are dictated by revised code and administrative code. I have to do those every year.
I'm trying to get the numbers straight in my head. So bear with me, I got three numbers, 265, 200, and 180 that we've talked about, right? The 200, which is what you're coming and asking us about, basically needs to be divided up between the subdivision and the grants, the 265 and the 180, going forward. So, and yeah, I don't think we're gonna get grants like we always thought we would.
Yeah.
So that's saying that that 200 has to be absorbed by additional monies to the 265. Does that make sense?
Yes.
That's 75%. Is that 200 number realistic? Or is, I'm just trying to understand the numbers, but if you're trying to get square and whole, you're coming here saying 200,000 is what we need annually for the next 2 years. When that goes away, what's gonna be the gap? What's going to plug that hole? Well, by that time, you're gonna have to have funding to match that 200, which basically says it's, and we know that grants probably aren't gonna do it.
Correct.
So that basically comes from the other source of your revenue. And if you divide those two numbers up, that's 75%.
And there have
So
been
I'm
discussions.
questioning the 200.
Yeah, there have been discussions, and I'm not on the finance committee, so jump into the 3 board members that are, about other ways. I know we have been encouraged, for instance, for a levy. We're not opposed to a levy, but we have some hesitation. I don't know that that is necessarily more stable than grant funding. But I don't know what else has been potentially tossed around.
The levy was one big discussion, but we know that, levy's gonna cost money to put a levy and to have a campaign to get a levy passed. And the likelihood of failure is more likely than not, especially the first go around. So we, although that's one of our plans, certainly, I think we've been creative. We are inquiring with we've talked about inquiring with other, health districts and seeing what they're doing and how they're doing it differently. Some do rely on levies, have relied on levies for their funding, so. And I think we need to be a little more aggressive in that inquiry. And, especially like size, like comparable.
Smaller.
Yes.
Yeah, we can't go to Franklin County and see what they're doing.
Yes.
Do you know how many other counties have levies, health departments?
I
Any
know
idea?
of a couple,
Does the state have any figures on that?
no, but we can get that. One thing that we have been talking about in admin and in financial meetings is due to COVID, some of our nursing programs have gone down greatly. We have lost the Help Me Grow. We are trying to build back up, the programs that we still have. My advice has been to the board, and I know that they have agreed with us, is that we really need to look at a restructuring of the department and seeing, what other departments are doing as far as their billable programs and restructuring to get those programs built back up or get new programs started to be built up.
And that was another hit too, so one of the billable services that has maintained through all that time has been our vaccine program. Obviously, that was a big deal during COVID. With the sudden loss of our medical director, this past year, our vaccine clinics also shut down legally for 3 months because we did not have a medical director to sign off on protocols. So we were able to find, replace, and get him to sign off on new protocols, but that was another dip, and, I don't know how, I know you had figured how much we lost during that time of not providing vaccines.
25,000.
So, increasing billable services can help the budget as well.
And another big hit we had this year was our, community, health assessment and plan came due. And that's not a cheap thing, it's a requirement for our accreditation. How much?
14,000.
14,000, and we didn't get as much contributions from the people that we partner with for that, funding, so.
Because the accreditation is not, how much is accreditation?
Accreditation costs us around $100,000 a year, and that's an unfunded mandate between having salary and then splitting up the chip chaw cost at $20,000 a year. Plus we have to pay accreditation fee of $5,600 just to be accredited. And then when you throw in, so like this year our accreditation fees are low. As we get closer to accreditation, that is going to be a lot higher. ODH has been recognizing that and are giving agencies that will commit to accreditation or to their efforts of accreditation, $50,000, and that should be coming next year. And there is a lot of lobbying for there to be some sort of funding sources, because agencies having to be accredited, it is a huge cost to them. And as we get closer to 2027, those accreditation costs could be rising.
And we have community partners that help chip in for that, and they did not chip in as much this past year. Again, inflation and everybody's under pressure.
And it's accreditation for a small rural hospital, county health department takes a big hit.
I remember when I was going to the meetings over there, I think you were going through the first accreditation
Right.
process, and I just thought at the time how ridiculous that was, the state making you spend that much money.
Yeah, and, that comes up in 2027, yes.
But we have to start downloading stuff in 2026.
So,
And this year, being hit with some TB cases has been hitting us hard as well, which is another unfunded mandate.
And those include direct observed therapy where nurses have to go. We have two, I believe both cases are still active. They have to go to the homes of those people and observe the medication being administered. Again, unfunded mandate, which is important. We don't want tuberculosis. And both of these cases came from outside counties and moved in here, and that's a hit we take.
We have a MOU that takes over the funding on that once it's.
There was a MOU in place, but I think when Kirby came, what I got from it is that the commissioners are responsible for, like, if a person can't pay for their medication, and I have been billing for that. But I've been told that it's not for the DOTs and everything that we do.
Direct observed therapies.
Right, yeah.
DOT.
Well, I'm going to ask the question that probably nobody wants to hear asked, but when we look at all options, we gotta look at all options. Has there been any discussion about what would happen if you would merge with another health district?
not to this point.
The discussion has come up. To be fair, most health departments are under this kind of pressure. I forget if it was you or maybe your director of nursing, received some education. It is highly unlikely that would be a quick process, or that someone's gonna necessarily want to merge with another
I
health
think more
department.
likely than what happens is you contract with other health districts to provide the services that are
That is much more likely.
necessary, is what seems like's happened in other places that don't have the support. Similar happens in coroner's office. There are a few counties that don't have coroners and they contract outside, and obviously it becomes a big cost, so.
We are still going through our, ARPA money to see what we have. I think we're getting down to the end of the thing, and, you know, over the years, people have put in for projects, and they came in under budget, but we haven't closed purchase orders yet. We're working on getting a final number. I don't know that we have that much ARPA money left, but we will see what we've got. And,
That ends the end of this year.
yeah, and I know you guys are under a time
So,
I think we're at a time crunch and we have staff that are on pins and needles, you know, so.
We've already lost 2 staff, who have directly cited this situation as the reason why they're leaving. They have to care for themselves. And I wanna say this too, when I came onto the health board, I've been on it for less than 2 years. There was some strife in the department, and I'm not saying that, there's a lot of them in the room now. We have some fabulous staff. We have some people that if we left them and figured it out later, they would be incredibly hard to replace.
yeah, and we have lost incredible people.
Incredible people, both people we lost due to this work.
Actually, I think it was 3, because our nurse, we lost
Oh,
2.
yeah.
So I guess another hard question is, how long can you last as you currently are?
Right now, and I've been presenting, since the beginning of the year, November, December timeframe is when
Tomorrow?
right now, we're good through November.
You're good.
Yes, with workforce grant. At first, it was looking more towards November, through cost cutting and through some staff leaving and not rehiring. We are looking right now to end December with a $4,000 carryover, however, that does not cover the January payroll.
I guess related to that, how much do you need to get to the end of this year?
I would say safely to be able to meet the payroll needs in January before we receive, any funding, I would say between 75,000 and 100,000.
Okay, I'll go a little further. How long will it take you to get to March when you need to request your other funding source?
As long as we get the workforce grant funding and we don't have any hits, I think we are good through March. However, if we have any major hits, anybody leaves with payouts, I would say we'd be closer to February.
Assuming you're not gonna get any grants, just assume that, because we haven't seen them come forward in quite a while. Assume we're not getting any grants. How much money from now till March?
If you take out all our grant sources, of what we're expecting in January, I would say to get us through to March, we would need 240,000.
Any other questions? You got anything else?
I'd like to say something, if it's possible.
2 minutes.
2 minutes. All right, so these are the ARPA allocations. We have HVAC, Mark's radios. We have fire pumps at Hardin Hills, elevator pumps. We have handicap parking at the fairgrounds. We have a big one on courthouse improvements, right? We have sheriff cruisers and sewer plants for 24 people. That is these $600,000 for 24 houses spent on these sewer projects. And you're telling me that the health department and the COVID funding that is allocated for COVID in our health department, they can't have it? You have the money. You have at least $675,000 still sitting in ARPA money, and you're giving them a hard time about paying salaries that they can't pay in November? Guys, who are we serving? The citizens? Take the money from the fairgrounds, the $500,000 for these buildings, and do something to pay these people to serve us. This is ridiculous. It should be a yes. Get a resolution. Absolutely, we will pay your salaries to keep a health department for 2 years. It's that easy. Anything less than that is a shame. Because this is how you've spent our money.
Thank you.
I just want to say that this is very hard for us. we have never done this before. We've been very self-sufficient all these years and have not asked the commissioners for, I think one year we asked for a loan and we paid you back in full. I think 2016,
No, this is
2011.
2011.
2011. So other than that, and we did pay that money back, we haven't come to you for this. And we wouldn't be here if it wasn't absolutely necessary.
And we did bring up a lot of the general services we do because we know this money is for COVID, so Dion did a really great job of funding those down, but when you're talking tuberculosis, rabies, sewer inspections, I don't even know all the unfunded stuff we do that if we close our doors, those things will still have to happen, whether there is staff to do them or not.
Okay.
And I really think the community deserves a local health department,
Yes.
not from another county. They need to be local and here for them.
We'll look at our numbers, and if you can, come up with some plans, moving forward.
Yeah, I'm particularly concerned about that, filling up the 200,000 per year gap. And how is that gonna happen? If we do this in 2 years, that's on them, so what's gonna take its place?
Yeah.
What's gonna take its place? And you're looking at 200,000 annually. So, and that's a big chunk when you figure $200,000 versus the rest of them. And I think Tim made a good point too, if you're thinking of levies or anything like that, that's something you gotta be thinking of quickly and get your stuff together so that you can get it in time to take advantage of.
I think the Ohio Revised Codes say that you do that. It comes through the commissioners.
Yeah,
The
we have to
levy.
make a levy request.
Right.
You establish what you need, what you wanna do, and then we approve it and it goes to the Board of Elections.
You have to have an idea what, how big a levy and like sets the current evaluation and kind of millage and things like that. But if you'd be, even on the spring levy now, you're kind of pushing it.
You're back to March of 27 before you would see
Before
the
you
first
apply.
dollar.
So you're still a year and a half out on whatever you're looking at.
Brad recommended a fall election.
The only problem there is if it fails in the fall, then you're into next spring and you push your collection back a full year again.
I think he's raising those costs.
Yeah, and I understand that when there's an off-year election and there's no primary,
Yeah.
and then you have a countywide ballot issue, you pretty well carry the cost of the election through the county, and that's not cheap. You consolidate a lot of polling places to keep the cost down as much as possible, but still cost.
So we are looking into things, but
Nothing's gonna be quick. It'll be-
Yeah.
Well, let me ask you a question, Michelle, you're always quick on levies. What's your
Yeah.
opinion on a levy on this?
Well, I don't think that's the question at hand right now. The question at hand is we have ARPA money available and they
Now,
wanna
please
use
answer my
the,
question, don't divert it. What's your thoughts on levies? Thank you.
Well, why don't we, I don't think we have to inconvenience everyone, but, get 2 or 3 of you to come back in, we'll schedule something in 2 weeks. Does that work? And then we'll have,
have enough time. Pardon me?
For staff.
Could we say a week?
pardon,
Could we say a week?
a week?
Yeah.
Can you have information around in a week? Yep, if you guys can work on that timetable,
Okay.
we will make every effort to work on our end too.
Sure.
And again, we're not gonna have the solution even in 2 weeks, so I mean, how much are you?
But pay attention to 200,000, how are we gonna account for that?
Well, thank you very much for coming in.
Thank you.
Thank you for your time.
I don't think they got it. Yeah.
She's on the screen.
Say goodbye to Marty.
Oh, she's
I'm
on.
already-
I'm just sorry, I just want names and titles. So I can refresh.
Good story. Can you go on the internet while you're recording?
Yeah.
I wonder if you can get it from there. Hardin County Water Voice. Hardin County Voice. Oops, you can hit both, right? This is
Should be on our part. So these are planned proposals. And you got them from this office? Okay. These are account numbers. It's not very user friendly on iPad, so, but I've got it here, so. Just trying to get both sides to each.
These are all the tabs. So they tell.
Everybody's putting their pay right there.
Right, and then, so like if you go to,
Treatment plan,
right, the sheriff,
cruisers.
yeah, so those are all. And then they have,
Is there like an ending balance for these funds? Or?
Yeah, I don't know. Oh, it's probably back here. So this is the one that you saw, right? And so, it gives us some, the thing is they have money that's allocated. Here's the grounds, it's the 400,000, that's what they want for the buildings. But they're not ready for the buildings, so it's definitely, could be reallocated. Oh, these are only notes. And then they have one that's for the city, that says how much they've given to each city, but the numbers aren't quite right. So that's all in that.
Yeah, but we already have, one person's here.
I try to put all my stuff out there, so different media
who's who. There's people out there, I don't know who's for the new group and who's waiting out there from the old group, so.
Good.
We're good.
I see.
Yeah, no,
Got two cozy chairs up here.
That's Charlie.
Hard chair and soft chair. Two soft chairs.
Hello.
How you doing?
Good.
Good.
How
you doing?
And then the attorney.
Yep. Oh, not today.
Zoning officer.
Zoning officer. Zoning officer. How you doing?
Many hats.
We have one more that's supposed to be.
Oh, okay. We'll wait a couple minutes if you want.
No raining out there?
Yeah. It's awful dark to the south, too.
Well, we could use it, but.
I think some of the farmers could use a break.
Yeah.
So while we're waiting, I'll pass this around. I did not bring multiple copies of that.
You can make copies if you like.
Work toward.
Do you just want one for three guys or you want one for all of you?
I think I'll just do it for all of them. 'Cause I'm sure Michelle will.
We are being recorded and put on YouTube.
YouTube.
Just one. Could you introduce yourself?
Nathan Schwartz.
Mike Holland.
Mark Schumer. So I'd be the zoning officer for Dudley Township, and these two are trustees.
Okay.
Charlie McCall will be the third one, who's also trustee.
Sorry, my phone's dying. So,
Hey, this is the commissioners meeting. Yeah. Yeah, we're sitting here now. Okay. What's gonna happen? That's all right. See you. Sorry about that. He's back in the field. Yeah, come on.
Racing the rain.
They didn't get any rain.
Have you guys already passed this resolution?
So we've not, this is a draft, I think it's gonna be first considered at our upcoming meeting, which is in 2 weeks. We wanted to have a little bit of a conversation with you before we kind of took that step. We're currently in the process of adding zoning language adding language to our zoning regarding the small solar facilities, what we can control, which is up to 50 megawatts. That amendment has been submitted to regional planning, so that process is ongoing. What we're looking for, I guess, from the commissioner's end is for regulation on the larger scale, so be above 50, which is what, the townships don't have any control over. From our understanding of the Ohio laws, it is possible for the commissioners to make all or part of the county a restricted zone for these industrial and commercial size solar facilities. So that is what's going to be kind of on the table for the trustees upcoming. But with that meeting in a couple of weeks, we're hoping to have a little discussion with you prior to that.
Well, for as long as I've been in office here, it's been our position that we leave it up to the local townships and to what they want. And you're the first that's come in and made a request either way. So, I think we're open to, if you pass this resolution and you bring it into us, we know what your thoughts, feelings are. And I think we will act accordingly and pass the resolution that you request. So I think Tim's probably looking for the procedure now on how we go about it. We'd have to pull out the rules and see just if there's any time frames that we gotta adhere to and all that sort of thing.
So we've had some discussion with Brad Bailey regarding the process in this, and just a kind of a short discussion on that side of it. But from my understanding is once this would be submitted to the commissioners, then you would need to set a public hearing on that with at least 30 days notice. So that timing, kind of gets a little funky here around the holidays.
Yeah.
But, in consideration of the number of residents that have come to our recent meetings, we think that there's a large percentage of residents that would be in favor of this resolution.
Has the township or owners, landowners in the township been approached by entities?
Yes.
Oh, yes.
Once?
Yes, they have.
There's, we believe that there's at least a handful that have been approached on recently, in this past year. I should say a handful that have actually signed.
That's
many more.
That was my next
Many more
question.
have approached.
Has any of these people that have been approached signed?
We've heard that. Haven't seen anything on paper, but we've heard they have. We were approached, personally, I was approached by the same company, we turned them down.
What company? Can I ask?
Green X.
Another new name I had.
Yeah, we have
Um,
and again, given that one, that have been a large site, not a small, less than 50,
They were just after ours for 100 acres.
or how much?
100 acres just from us personally.
Just, okay.
I don't know.
What we've been presented with by some of the residents is up to 700 acres they're looking to sign up.
This small Green X company, they were looking to sign up at least 700 acres in the small area that they were, I guess, confined to. It sounds like these different companies come out, they get different sections of the township to try to get signed up.
And then sell it one for the project.
Right.
Well, I know there's a certain time or a point that if a developer is at a certain point, and I think, without looking again at the paperwork, but I think it's once that's filed with our siting board, then no matter what we do, they're grandfathered in. But it doesn't sound like you've got any that are near that point. We haven't heard of them here. Usually we hear a little something out of them before they file.
And again, this is what is being looked at as solar.
I think the wind is a dead issue.
I think that's-
Nobody's putting up wind turbines anymore in this part of the country anymore.
Well, real quick, this is just, the handbook, you probably got the same.
Thank you, Jim.
Yep. This is 2.02, just a summary, but basically, this is the Commissioner's Manual for Renewable Energy Generation Facilities. The summary under Law 202, Board of County Commissioners can restrict deciding certain renewable energy projects within an unincorporated area in the county. These installations are defined as large solar facilities, nameplate capacity of 50 or more megawatts. Economically significant wind farms between 5 and 49 megawatts, and large wind farms of 50 or more. 2 tracks commissioners can take to excuse this authority. The first is the ability to design restricted areas within the unincorporated area of the county. Commissioners may designate all or part of the unincorporated area of the county as restricted area, prohibiting construction of significant modification to the solar and wind projects designed above. Boards may comply with the statutory procedure, including notice requirement of public meetings. Commissioners may designate a restricted area. County voters may petition for a referendum to approve or reject the creation of a restricted area. And, well, if the project is proposed in an unincorporated area outside the restricted zone, the laws allow, after certain procedural steps, complete, the Board of Commissioners can adopt a resolution to either prohibit the construction of the project or limit its geographic scope. Unlike a resolution creating a restricted area, the project-specific resolutions are not subject to a voter's referendum. Then it goes into membership on the board. That's just a quick reference. But,
So, you know, whatever decision we would make could be subject to voter referendum.
Right.
yeah, so it's kind of.
So I don't,
It talks about a 30-day window of referendum of restricted area, but if you want the whole manual, I can run it off. If you need it for law, or
It may not be bad to have, you don't need to run that today.
we'll make you a
I
copy.
can look at it on the Monday.
It's the latest guidelines we have, so
That'd be helpful.
that was as of December 2021.
yeah, you won't, I don't think, have any objections from us to follow what your desires are for the township. You know, we've had the policy that, you know, it's owner's right to use their land, and it's up to the township to decide what their township residents wanna do with their land. So that's why we've kind of thrown it back to the townships, because you're closer to the people that are directly affected than we are.
And
You know what they want.
Any questions?
Just giving you a heads up.
Yep, very good. Well, we'll do our homework and make sure that, we're ready if we get a copy of your resolution. Thank you.
Thank you.
Thank you.
Paul, How many acres do you think they're trying to get over there? Of the people that they talked about?
The last thing we had was 3,500.
3,500.
That was a big project. That was a big.
That's a big,
Yeah.
around 3,500, it's about 50,000, maybe more.
And it's usually about 30. It runs between 100 to 200 acres. 50.
Thanks for coming in.
Thank you.
Think so?
Oh, Roger's looking. Are there any trees down in there?
Any what?
Trees?
Trees?
Yeah, I don't know. Apparently a couple of trees went down. Jed said there was something, one of them laying over here, not a tree, but a big limb on one of the canopies.
Oh.
At one point when I was standing back there, I saw something blow by this window, and I was like, was that a street sign? Was that a? It's definitely calmed down.
Yeah, I haven't seen anything up there. Got used to it now. So we all done, Tori?
Yes, sir.
Okay. Let's see, don't have anything tonight, so.
I go,
Done for the day.
I go after you. I got little kids coming up. So
Oh.
trick or treat. In fact, we haven't tonight, maybe. I think.
I think Captain's is done, isn't it?
I think ours is always on Thursday.
Just so happens it's
Just
Halloween this
it
year.
happens to be Halloween.
Yeah. Okay. Well, probably see you next week.
Okay.